surgery tomorrow. And I was like, and I had a sister. And then I had trigger finger, so I took a couple times. Surgery tomorrow morning at 7. And I was gonna have to, I heard it work. I was gonna have to come home and wait for my children after work. So now it works out. I just said,
Better start there. Yeah, first. They're getting a list. So some people are still signing up. They're on their way in. So if you want
Half of 160 is 80 something. Isn't 160? That's 80, isn't it? Goes that way. That's flashes. Should go this way. Oh, damn. Yeah. Thank you. Take what take what you have, so you have 160. And you take 49 off. Maybe right. It's 1.1. And half of that, half of what is 50. You're right. They're right. Actually, they're right. Because you have to, they exited 49 people, which gave them 111, and 29 successful, which is 59%. Yeah, so I do the right.
yeah, that looks like everything.
All right, with that being said, we are going to call the meeting to order. Good afternoon to everyone. Thank you for attending the Jail Oversight Board meeting. I'd like to say first and foremost, We'd ask that you treat everyone with the same respect that you would expect in return. Public comments, if you do not sign this sheet, you will not be permitted to provide a public comment. So you must sign up on the sign-in sheet if you intend to speak. With that being said, we'll start with roll call. Judge Lazara.
Present.
Abbas Camara.
Present.
Our County Controller, Corey O'Connor. Terry Klein. Richard Fitzgerald.
Steve Polarski.
Sheriff Kevin Kraus. Here. Gail Moss.
Present.
I forget his name.
Bethany.
No. What is the guy's name? Pat Katina.
Bethany Hallam, present.
Thank you. I think that's it. So with that being said, we've rearranged the order a bit. There are a number of people that have some pressing events that they must attend this evening, so we're going to change the order up also to prevent the public comments from being at the end of the agenda so that people have an opportunity to speak. So with that being said, we're going to begin with community corrections. Passages to recovery.
Hi, good evening. Kevin Corsi, Passages to Recovery. Let's see, over the past month of October, we've had 11 admissions into the program. 7 of those are men, 4 of those were women. Right now, census is 21 men and 11 women. We also have 7 men and 2 women in our transitional living programs. Successful completions this month, we had 5, 4 of which moved into the transitional living program. And also, let's see, been working with Contacts for GED programming and have had several clients who started working on their GEDs. Trying also to get an outside provider to come in and do a fatherhood program, but that's been difficult because of the constraints they have. They tend to want to do a closed group, which starts with a certain number and finishes with, and with a constant kind of turnover, that makes it almost impossible to do. Community-based support passes are continuing. We also started family visits, in-house family visits this past weekend on the 30th. Clients also had a Halloween party on the 30th also, and that's pretty much it.
Any questions, Ms. Moss?
Yes. Would you repeat how many you said there were in the program? Because I missed that.
Census right now?
Yes.
I've got in residential, the residential treatment program, I've got 21 men and 11 women. And with the transitional living, I have 7 men and 2 women.
Thank you.
Ms. Hallam?
Yeah, thank you. Is it this? Okay. So have you guys solved your food service issue? Like, if you have any issues since last month, you're good now?
Yeah. When I spoke last time, our second cook that works weekends, she does a 4-day week. She had started that Monday, so she's been there for a month now and haven't heard of any problems.
Awesome. Thank you so much for the update.
Sure.
Any additional questions? Thank you very much, sir. We'll now hear from the Renewal Center. Maybe not. Oh, sorry. Sorry about that.
Hi, good afternoon, everybody. Adam Zach reporting for the Renewal Center. So last month, Ms. Klein, she wanted to know our COVID numbers from the previous months. For staff cases for the months of September and October, we've had 4 total positive cases. And as for reentrants for September and October, I'm pleased to say we've had 0 cases. We've continued to do contact tracing, testing, and quarantining, taking all precautions necessary, and hopefully next month I'll be able to say we have double zeros. As far as employment, out of all our employable reentrants, we are at 71% for the past month. And also coming up next Sunday, or this coming Sunday, November 6th, we have 20 men and women. They're going to be volunteering for the EQT 10-mile race in downtown.
Any questions? All right, thank you very much.
Thank you.
Electronic monitoring.
Good evening, Board. Steve Eswine for the Probation Office. Just some highlights from our report. We had 644 individuals enrolled at the end of the reporting period. During that time, we had 106 that had successfully completed. Judge Lazare, for your knowledge, we do have one that is on the SoberLink device. And our goal is to have some new devices by the end of the year. So we're in the process of getting those. So hopefully by the end of the year, we'll have them. Okay?
Nice to see you.
Yeah. Any questions?
I do have one question. When you say new devices, are you referring, what specifically are you referring to?
The new SoberLink devices.
Okay, just SoberLink,
The
okay.
portable breath tests, yes. So,
Okay, any other questions? Thank you very much,
Thank you.
sir. All right, again, out of an abundance of caution, we're going to go to the motions at this time. Ms. Hallam?
Thank you, Judge. So my first, are we going to do motions, or am I doing everything in new business, like jail inspections?
Just
too?
motions,
Okay,
please.
cool. So the first motion is the one we do every month. You'll notice the amount is still the $125 that we're doing till the end of the year. Motion to request money from the Incarcerated Individual Welfare Fund to be put on the joint tablet or commissary accounts of each person. When I wrote this motion, there were 1,425 folks currently incarcerated at the jail. At $125 for each person, that's a total cost of $178,125. I'd like to make a motion to approve.
Second.
All in favor?
Aye.
Aye.
Any opposed? Motion carries.
Okay, thank you. So my next 1, 2, 3, 4, 5 motions are a kind of lumped together, all under the same topic of books. We've been hearing month after month after month all the issues with receiving books in the jail. And so I'll kind of just give an overarching problem. So the problem has been that according to the jail, the only two authorized book sellers for incarcerated individuals in the jail are Barnes & Noble and ChristianBooks.com. So the jail also claims that a paper receipt is required when they receive the book in order to not return it to sender, return it to where they bought it from. Barnes & Noble is no longer doing that. So as of right now, the only books that people in the jail can get are from ChristianBooks.com. So these are addressed at that. So the first motion is trying to support our local bookstores. The one friendly amendment that I would like to make to all 5 of these motions is if everyone would be okay with, instead of making these forever going forward, that this was just a 90-day pilot program, that we try accepting books from these local bookstores. We see if there's any additional issues. We try to accept, we try to not refuse paper receipts. We try to accept them from USPS, FedEx, and USPS. We're just going to try these motions for 90 days, 3 months. So if everyone's okay, before I introduce any of the motions, I'd like to make a friendly amendment to a 90-day pilot program for each of these 5 motions.
I was going to make a friendly amendment that we have a subcommittee sort of talk about them all to make sure that they're all good. I want books, trust me, I love books. If you saw my house, I have 7 million books everywhere, and I think it's the most important thing we can do. We give all of our mental health code people who have babies books because it's that important to start reading early. So I truly believe in that, but I think that there's so many things that at least having a couple subcommittee meetings to talk about it and figure out, like, can we do this with the jail? Are there problems we don't know about? Because I don't want to say that we're going to do this and then it doesn't work and we're back in the position that we've been on other motions where we sort of jumped the gun. So I would simply like to have a subcommittee that we would get together, and you know our subcommittees work, that we could get together and figure out those things, get some input from the jail, make sure there's no issues, and then come back with a comprehensive, like, this is what we want to do, and it'll be done, because it'll be done, like, not scattered, but thoughtfully.
Yeah,
Not that you didn't think about it, Bethany.
Yeah.
I'm not saying that, but
I was going to say I thought a lot about this, Judge.
But just to make sure that we have all the input from all the players to make sure that it, you know, we say city books and they say, well, there's a security reason why city books can't do it, and then, you know, we're giving people hope that is not going to happen. So, like, if we have a chance to sit down and talk about it, I think it could be helpful.
Okay, so specifically City Books and Classic Lines, which is now Riverstone, they have already said that they are more than willing. They participate in a program with other correctional institutions at the federal and the state level, and they have already confirmed that they are willing to do it. But in that case, can I offer a second friendly amendment instead of doing that is because in the meantime, what are we going to do? I know our subcommittees are great and I know that we get a lot done in them, but the reality is we've been talking about this for 6, 7, 8, 9 months and nothing else has moved. And so what I would ask if then instead, if we could do maybe talk about the first one and the different people we accept them from, but in the meantime, so that people can continue to get them from Barnes & Noble and ChristianBooks.com in the meantime, we do 2 through 5, which is the first is a motion to prohibit the Allegheny County Jail from refusing any book shipments simply for lack of a paper receipt, since Barnes & Noble isn't doing paper receipts anymore. The second one is already part of the jail's written policy that we accept book shipments from not just USPS, but also FedEx and UPS. And then the third one is letting us know if you do deny a book, tell the people who are in jail why, and then the fifth one is tell us why. So while we have those subcommittee meetings to figure out if it's possible for us to expand, can we maybe move forward with 2 through 5?
Well,
Would everyone be okay with that?
My only issue with the thing about the no paper receipt is, are we aware that it's coming from Barnes & Noble? Like, if somebody just sends a UPS book, I don't know who it's coming from, and there may be some issues with being able to know that it's coming from Barnes & Noble as opposed to it's coming from the person who's trying to deliver something in that book that's contraband. So that would be my concern with that. And I think people are jumping up and down from the jail that want to chime in.
I can tell, yes. Go ahead, Warden.
Can we let them do that?
Sure.
Good afternoon, Board. What we would like to do is talk about some of the issues that we have pertaining to the motion, so we can give you guys, if we could be given the opportunity to talk about it before you make your vote, we would greatly appreciate it.
Right, and we will wait to vote on accepting from other retailers, but in the meantime, I just don't, so again, we are only accepting books right now from ChristianBooks.com. I can't even wait a month letting that happen, that being the only way you can get books. So I would be okay with still doing the 3-month pilot as the friendly amendment and waiting on the first one if we can move forward with the last 4.
And I would like to add something to that, too. What about Carnegie Library to be added to the list?
We did partner with Carnegie Library or something because there were some issues. I think Deputy Toma can speak to some of
So
those.
I can say for a fact we are receiving books from Barnes & Nobles, not just Christian books. We have received them. We do accept them. They have been delivered. If I can speak to some of the items that have changed since the last meeting that we have implemented that do address a few of these motions. if you don't
Sure,
mind.
they relate to these motions?
Yes,
Okay,
absolutely.
sure, go
And I'll
ahead.
limit them to those.
So what about
in-
Carnegie Library?
So
Because I was
we-
given
won't.
a call about their interest.
So you would have to, so Carnegie Library, we did partner with them when we established the e-library. That is a continual conversation we've had. It kind of was held up because they had some changes within their department, and we tried to reestablish those communications. But there is some limitations based on how the ebook library exists and the programming that is. So it is a continual conversation we're having. But are you speaking to
Well, I
physical
would just like to
book
have them on this list of when we check.
to
see.
buy from them?
Not so much buy. They were willing to do some, like, when I was talking to them, they wanted to do something via, maybe on their tablets or something, and they talked to me about that.
Yeah, we do have an individual, I can't remember her name at this moment, that is one who curates their e-library system. So we do have her contact, and we were engaged with her, and we are trying to reestablish that engagement. So that is something, but to speak to
Also, real quick, though, I just remember at a previous meeting, we had asked about that for expanding the ebook library, and we were told, I don't remember if it was Mr. Pilarski or someone, but we were told that the Carnegie Library couldn't restrict the content enough, and that's why we didn't partner with them, that they couldn't follow the content restriction guidelines that the jail had. That's, if anybody remembers who said that, that was brought up at a previous meeting. No. Okay.
Well, I'm willing to work on that.
Yeah, I think that's a great idea. Okay.
I would work on the book issue.
So in regards to your motion to prohibit Allegheny County from jail refusing book shipments for lack of paper receipt, we have engaged Department of Information Technology and Administration Services. Administration Services is the department of the county that processes all incarcerated individuals' mail. So they are the ones who receive the mail, and they're the ones who process it. We have engaged them to identify a mechanism to receive the receipts electronically. So you order a book and you submit the receipt that you receive in the email. We're also addressing the fact that we can can get an email account for that person so that we can notify them if a book for any reason is not accepted, whether because they accidentally ordered a hard copy. Currently, when we receive a receipt, we have no mechanism except their home address to send them a letter in the mail, which could take days. So these are other things as we've gone through the process improvement to identify. So we have engaged DIT, we have engaged administrative services, and we're talking through that process. So we're hope to have a solution for that part. We have received electronic receipts, and we have accepted books that way, or we are in the process that we have people have reached out to us.
And is this a program that you believe will be implemented within the next 90 days?
I can't speak to it. I would have to speak to those two departments. Again, they are not departments within the authority of the jail, so we have to engage those other two county departments.
So then this can bridge you to that?
Yes.
Great, thank you.
All right. So, and most accept the books from USPS, FedEx, and UPS. We do accept those. Again, administrative services is the department that receives all mail and processes for the incarcerated population. We did identify that some deliveries were not going through administrative services, and they were being delivered through other means to the facility through the USPS and FedEx to locations that don't accept mail for the inmates. We have closed that loop, and they are being redirected to administrative services. I can speak to that firsthand because I am the stopgap in that, and then it goes through me to them. So I've been able to confirm that process is in place, and we have been receiving those.
So sorry, I just want to clarify. You currently are accepting book shipments from USPS, FedEx, and UPS?
We have always received them as long as they went through administrative services mail delivery. If they were delivered directly to the jail and not through administrative services procedures, there was an issue with there, and we have identified that issue, and we have closed that loop, and they are now being redirected through administrative services.
Great, so that third motion is moot because it is happening already. Everyone agrees?
And we've also updated the website to reflect that.
Okay, thank you.
Motion to require Allegheny County Jail to notify incarcerated persons in writing with their books were rejected or confiscated the reason why, and provide an opportunity to appeal the process and consistent with their rights due process. We have implemented this. I have been notifying individuals where the books have been returned for receipts or other reasons. That is going through the tablets for facilities messaging directly to that individual. We have also put in this request for programming to have book order and order appeals onto the tablets through the same request process.
So
they'll be able to make recommendation.
go ahead. I have a question when you're done. Go
Sure.
ahead.
They'll be able to make recommendation requests, not only for books, for us to add to the e-library, but them to have updated for the circulation to their pod locations, as well as a mechanism for them to submit an appeal when they receive that facility's messaging notification. Those two are not in place yet, but the programming request has been made.
But the appeals process and the notification process is in place?
The notification process is in place. The requests feature for them to appeal it, that the programming request is made. I have not gotten confirmation that that has been added to the tablets.
And what about the people who don't have access to tablets?
Everybody has access to the tablets, with the exception of those that are on certain tier levels. Those individuals will be notified via paper.
Those who are on certain tier levels, those who have damaged tablets in the past?
They still receive a tablet, even if they have damage.
Some people do not. You're saying the only reason that anybody doesn't have a tablet is because they are classified as a certain mental health tier?
Yes, ma'am.
That's not true. People who are on lockdown, people who are in DHU, they don't have access to tablets. I've spoken to people in the general population on their pods who do not have access to tablets because they have somehow misused them in the past, whether it was from sharing their tablet with someone who wasn't allowed to have one, whether it's from repeatedly damaging a tablet and not paying the fee to have it restored. That is not true what you're saying about the only people not getting tablets are people on mental health tiers.
They have access to the free portion of the tablet. They would not have access to the paid side,
No.
which is the inmate messaging, religious materials, education materials, things of that nature.
There are people who do not have a physical tablet. I'm not talking about what they have access to. I'm talking about people who are not allowed to use tablets, not just people on mental health tiers. I have seen them. I have talked to them.
I mean, if you could provide us some examples.
I can actually pull up the meeting minutes or video recording of previous meetings where we were told that also, where we were told that people who were on DHU were not allowed to have tablets. Are you saying that's not true?
They have a restricted window for their tablet use. That has always been the standard. So they don't have the same windows of access that a general population inmate would, but they are still issued a tablet.
I think what he was saying, maybe offline, if you could provide specific names, it's something that he could research.
I'll go in the jail and walk around and talk to everyone. Sure.
No, yeah, but if you have them, you might have them from the last time you went through.
Sure, I have at least one from the last time I went through, and also
I
I
just
have
don't
the-
want to, say the names out loud here per se.
Yeah,
either,
but I also have the recording of this meeting where we were told that there were other categories of people who were not allowed to have tablets, such as the ones I mentioned. So it's not just my own personal experience. I'd be happy to add that, but also we were told that as a board in the past. But, okay, that's great if what you're saying is true. I just know that it's not. But, okay, so then the people who do not have access to tablets, say they're on the mental health pod, are they not allowed to have books ordered to them either?
Depending on their status.
Okay, so I guess my question is, besides notification through the tablet, how are people getting notified if their books are rejected and the reasons why and how to appeal?
Those individuals will amend to have paper sent to them, as well as if they don't have access to the tablet for whatever reason, they can still use paper request process, which is another agenda item that will be addressed today.
Okay, and when did you start doing this notification?
We had the programming completed this week, so we started to send out notification this week.
So,
Okay, sorry, Corey, I stole
I
one from
just
you.
had a
Go
question on
ahead.
that. So if you're just doing it now, the 2020 policy said you guys should have been doing it.
Mm-hmm.
Are there copies of this that we could see, like something that was rejected, a reason why?
Again, so one thing that we're working on is administrative services is the one that, again, handles the processing of the mail. That information is entered. We're still working to extract that information as to the process that they conducted. These responses are coming directly from jail leadership to these reasons. So we've closed that gap between administrative services, another county department, and jail administration, who is now owning that process and giving that information, whereas before it was handled by a different department.
So, but it was a policy since 2020, so you have been doing this.
To notify.
You have been notifying somebody because the books have been rejected. So if the policy was there in 2020, you have to have copies of letters that you've written to individuals why something was denied.
I'd have to check with administrative services.
Okay, if the policy's been there for 2 years, I would just think there'd be copies that we could get. And look, if you're gonna check, that's fine, but I'd like to see a copy of those. And I know the next one is the books, and I know we've asked that a few times, but I'll let you answer the book separate. Just if the policy was there, there should be copies that we could see why something was rejected, whether it's handwritten or emailed, whatever. That's all I'd like to see is the response letter that we sent, or that you all sent. So thank you.
Yeah, I'd like to add on that. I'd like to see a few copies. If this has been happening since 2020, I would love to see a couple examples of that. Thank you. Okay, and so then if this is apparently already happening, it's just wild because it's like when I talk to people who are in jail and I talk to their loved ones, what Jin say to us in this meeting and what is actually happening are so different. So different of like things I see with my own eyes, things I hear with my own ears, people I talk to, people who have been in and out of there themselves in this period of time. And like what Jin's come here and say is just so different. I don't know how to like get everyone else to see that and us to do something about it. But there is such a disconnect here between what we're being told and what is actually happening. But I digress. So the next motion is a motion to basically what we were just saying about letting them know when their books are banned, let us know as well. So anytime a book is banned or confiscated, to give us a list of that title and the reason why.
So that we would like to have that, just as was the example given for the state, to have that posted. So on our website, just like we do with other reports that are posted. So that is something that will be publicly available as they come. It should be noted that every single book that has been not accepted for content is going to be going through no appeal necessary through the review process that we're in place of working out and finding contributing members.
And what about books that are rejected for reasons other than content? Are you going to notify us of those as well?
For administrative reasons?
Sure, for administrative reasons, like 100 books this month were rejected because they came from UPS, and we said that would never happen again, and it happened. Like, I'd like to know about that. Not just banned for content, but any sort of confiscation, letting us know about it so that we can keep track of it. I think it's important for us to see, you say this isn't happening, I know it is, like, let's see the numbers. Okay, that would be great. Along with, as the controller requested, I would also like to see the previous notifications that have been given since they've been happening for 2.5 years now. Okay, so going through that then, what motions? We agreed to hold the one and just not vote on that tonight. We're going to do that after some committee meetings. That's the one about listing additional places we can get books from. I'm cool with that. The motion to prohibit the Allegheny County Jail from refusing any book shipments for lack of a paper receipt from an authorized bookseller. Again, for only 90 days. I would like to make a motion to approve. We try that for 90 days, not rejecting for a lack of a paper receipt as long as it's sent from one of the approved vendors.
I thought the jail just said they were addressing all of these things that you just discussed.
Correct, that's why, but they also said when I asked if this would be a bridge in the meantime, the answer was yes.
Oh, I thought you meant, I apologize. I thought you meant a bridge, like DIT, what we're working out. I didn't realize that that was the quest. No, this, accepting a book without a receipt for us still pose an issue.
Right, that's why we're only going to try it for a pilot program for 90 days, unless you can tell me that by the next meeting, you're going to have your system in place for the email receipts, but you said you're unsure of that. So if that happens, then we can stop this because you're going to be able to send an email receipt.
I thought we were going to try to do that in the subcommittee.
I thought we were only going to do the first one in the subcommittee about who else we can get books
I mean,
from.
my proposal was to talk about all of them in the subcommittee to find out, because the receipt issue, I can see there being a security reason for this, for the receipt issue. If they don't know where it's coming from, then they don't know what may be hidden in the pages. And there have been issues of things being sent to the jail that are contraband and that have injured people. And so, you know, to me, just to force them to suddenly accept books without receipts when they don't necessarily know where they're coming from doesn't seem like something we want to do without a further conversation. And you know.
So what do you propose that we do in the meantime? Because I'm open to suggestions, but there is something that needs to be done now, because this has been happening for months and months, that Barnes & Noble is not sending paper receipts every time. And
But if you've listened to her, she said they're now accepting them on e-receipts, right? They're getting electronic receipts.
that's not in place yet, I thought you said.
The procedure to have it centralized is not in place, but there have been e-receipts that have been received, and we are in the process of receiving those books if I have received them electronically, except that is not a foolproof method, and nor is it sustainable for what we are doing now. That is why we've engaged DIT. That is why we have engaged administrative services to find a sustainable process, which we hope to have resolution on. I can't give a timeline because I cannot speak for other departments' commitments to.
I can speak that once the election's over, which for DIT and administrative services might go to the end of the month, towards the end of the month, it goes past Tuesday, that those departments do report to me, they don't report to the jail, and we can commit some resources to work on it to finalize those things. So that I can make that commitment.
So, but if it's happening for some people already, if you're already accepting books without paper receipts,
I think what they want to do, if I understand, is you want to strengthen this process. As right now, it's a manual process. You're engaging DIT to try to help make it less manual. I don't know that you're ever going to eliminate it as 100% manual. There's always going to be some type of manual intervention, but you're trying to make it less manual.
Yeah, and as well as have more eyes on it than it going and having more sustainability. Right now, it's not a sustainable procedure.
how many books would you say are sent to you from Barnes & Noble every month?
Again, I can't speak to that because, again, we're trying to extract that information. It's kept.
But I mean, is it hundreds? Is it thousands? Is it dozens?
Books individually, I can say that.
Orders from Barnes & Noble.
In the past week, I've probably seen 20 orders from Barnes & Noble.
So there you go, 20 emails a week. I mean, if that's our hold me over, I'm cool with that. We just need to decide today. I'm cool with stepping back. I'm not really cool, but I will step back from the amendments. But we need to do something today to make sure people can get books until these systems are in place. It's just like everything else that is come in front of us and told us this is happening, this is happening, this is happening month after month after month. It's been happening for at least 6 months now that we've been hearing about it every single meeting, that books are being rejected because they don't have a paper receipt. Barnes & Noble isn't always sending one. They themselves have said that. So can we figure out something then for right now just to hold us over till we can have our committee meetings and strengthen our process?
But you said Barnes & Noble is sending a paper receipt.
Yes. And those are only the ones that I'm aware of, that the 20 books that orders that I mentioned that I'm aware of. I don't know of all the book orders that administrative services.
I have seen evidence of at least a dozen Barnes & Noble books being rejected for not having receipts. And Barnes & Noble themselves have said that they are not sending paper receipts with every order anymore. So I know that for a fact. Again, another thing.
But they're sending it with some. Do we know why they're sending with some and not others?
It has something to do with the distribution center that they come out of, and when you place an order, you don't control what distribution center it comes out of. They have two main distribution
yeah.
centers. One has
Jersey
paper
and-
receipt, the other one doesn't. So when you place an order, you have no idea where it's coming from.
The email that I received from Barnes & Noble states that both distribution centers are giving paper receipts. It's when a order is fulfilled not at a distribution center that they are not fulfilling it with a receipt.
So some orders from Barnes & Noble are coming through without a paper receipt.
That make it into the facility or that
No,
reach
some
the facility?
orders from Barnes & Noble are trying to be delivered to the jail, and they do not have a paper receipt.
Correct.
Correct. So can we please find a solution? If we're going to forego all these motions that I spent hours laboring over, can we please find a solution for now?
Well, one is moot. That's good news. One's moot, we said. You said the one was moot.
We'll see if that actually happens. They claim one is moot.
Well, look, so first of all, can I make a motion that we immediately start a subcommittee about the books? I know we've had this discussion before in the Incarcerated Individual Welfare Fund subcommittee. We started to talk about it, and then there was additional research that needed to be done that didn't get done for a long time, and so it got put on the back burner, and it was put on the back burner again because we were waiting for the study to come in based on the surveys. We have survey information, we have a ton of information. I think we're ready that we can act and we can do something. So if we can have a book subcommittee that will focus on this issue and have a good recommendation to come back to the board with next month, we can work on that quick.
I will like to volunteer to chair that committee, please. I'd be down for a subcommittee. Since everyone else has one, I'd like this to be mine. Cool? Motion to create a subcommittee about books that I will chair. I'm asking for a second.
Well, wait, Judge Halsey is the chair of the committee at this point in time, so he has to call the vote, okay?
I wasn't
So
calling a vote, I was just making a
I haven't
motion.
even had a second on my motion yet. So the first idea is, do we get a second on the motion
For what?
for the book subcommittee?
Second.
Okay, so we have a book subcommittee.
All in favor?
Aye.
Aye.
Any opposed? Motion carries. We'll table these motions until we have a motion subcommittee developed to address these issues.
And any information that can be provided on the status of the books in the jail, if you can bring it to the next meeting so we know where all of these processes are happening and what's happening, I think that would go a long way. for
Yeah, just on
everything.
that, I mean, the last two motions, that should be information that we should be given. I have a right to know, and I have the list of books that have been banned here. So, I mean, if I could get it, or whoever got a right to know, and we've got a copy of it. So the right to, or the books we should all be given. I mean, I have a list, I can copy it. But then also these letters, we should get those as well. So I don't know if we need that motion, but.
Are you making that motion? I'd love to second it.
Wait for clarification. You wanted the ones that from 2020. You made a statement that.
Well, the
Since.
policy's been around since
Right.
2020.
I
So
understand.
if there are letters of why you banned something, we should be given those letters. There's got to be a copy of them. So, that's information we should be given. I don't know if we need a motion for it, but.
We do.
But, I mean, that, and obviously I got the list of books, so that's out there too. So if we can get those two, that's basically the last two motions anyways.
But again, Controller O'Connor, aren't you frustrated that we as the jail board had to get that information via a right to know request as opposed to present it to this board? That is absurd. We've been asking for this for months, and a friend of mine had to file a right to know request to get the information that we are, again, statutorily obligated to receive and have not received since the policy has been in place since 2020. That's absurd. And everyone on this board should be mad. Why are we finding out stuff from right to know requests and from the news when we're on the jail board? It's nuts. Yeah. No, you're right.
Will you be able to provide that information?
Just get that information, yeah.
Will you be able to provide that information?
The information on any letters that were delivered, if they exist, they'll be provided, and we will We are, excuse me. Any reasons for what books were not accepted in the facility and the reasons why they were not accepted?
Well, can we have the letters or the information for the committee before the board meeting so that we
That
will
would be
have
awesome.
something to deal with
I get you.
while
I
we're
think
getting
as soon as
ready
you
for
can
the next
gather it, you
meeting?
can get it out there, but there's no
Yes,
reason to
before,
wait.
if you could.
So we're getting the notification letters to incarcerated individuals why their books were rejected, and we're getting the list of books that were rejected. Yes, is that it?
The right to know, right?
Yeah,
All right, with that
before
being
the next
said,
meeting. That's all my motions, Judge.
We'll now move to the Warden's report.
So the first thing I would like to talk about is training at the ACJ. The jail completed autism awareness training with the Autism Connection of Pennsylvania in October. 6 in-person sessions were held during the month of October, and approximately 140 staff members attended. These trainings have been recorded and are required to be viewed by all employees as part of their continuing education. Additionally, de-escalation training began on October the 18th.
I'm sorry, forgive me, because we went out of order, one misstep. Did everyone have an opportunity to review the notes from the last meeting? My apologies.
We voted on the minutes?
Yes.
Yes.
Motion to approve.
Second.
All right, all in favor?
Aye.
Any opposed? All right, motion carries. My apologies. Now I think we can go into the Warden's report. Thank you, sorry about that. We just need to approve the minutes. Sorry about that.
So additionally, we had de-escalation training that began October the 18th and will continue until all employees are certified. This is the same process that we completed with mental health first aid training earlier this year. The Renewal Center. The jail will host the warden and staff from Washington County Jail for a tour of our Renewal Center on Friday, November the 11th. I will provide an update of the tour at the next Jail Oversight Board meeting. Voting access. The jail held its election by absentee ballot today in conjunction with the Allegheny County Elections Department. A total of 42 individuals voted today. Anyone who becomes incarcerated between now and next Tuesday who is currently registered will be provided an emergency absentee ballot application. In addition, 21 individuals voted in this year's primary election in May. The jail began conducting elections at the jail in 2004. We've seen consistently higher turnouts in recent years. We had 55 individuals vote in 2021 primary election, and 27 voted in the general election. In 2020, 93 voted in the general election. We had 20 vote in the 2019 general elections, 19 in 2018, 2 in 2017, and 40 in 2016. Reentry services and programming. Alcoholic Anonymous meetings returned to the facility in mid-October. And we are also looking to bring Narcotics Anonymous back to the facility soon. Meetings were discontinued as part of our COVID-19 mitigation efforts. But we recognize that many people who come to our jail struggle with addiction issues. Both AA and NA are vital tools we can provide to these individuals while they are incarcerated. The Reentry Service Department continues to offer classes and vocational training opportunities. The most recent cycle of reentry classes began October the 11th. Among the incarcerated population, 211 signed up and 189 showed up for their classes. Of the 22 who signed up but did not participate, many were individuals that were transferred to alternative housing in the meantime. Discharge and Release Center. Our Discharge and Release Center continues to assess between 300 and 400 individuals per month and refers them to services. This past month, the DRC, working with AHN River Clinic, was able to help release individuals, and individuals returned to San Francisco. The River Clinic and the Greater Pittsburgh Community Bank continue to be the DRC's top referral services. The center referred 45 individuals for food assistance, 37 to the River Clinic, 34 to the Foundation of Hope Aftercare Program, which help individuals obtain state identification and other basic needs after release. The center also distributed 59 Narcan nasal sprays and 412 bus passes. The Chaplaincy Department. The Chaplaincy Department continues to prepare for the upcoming holidays. The chaplaincy is obtaining goods and donations for holiday packages that are distributed to the incarcerated population in December. In addition, the chaplains work each year with the Salvation Army's Angel Tree Project, which provide holiday gifts for children of incarcerated individuals. The gifts include a written note from the incarcerated parent. The pre-release center welcomed a new director in October named Liz Lepore, who joined the staff. Originally from Massachusetts, Liz comes to the jail with 31 years of programming experience at Holy Family Institute in Pittsburgh. Amachi press release. On October the 17th, our reentry coordinator, Amy Kroll, and myself attended a press conference at Amachi, Pittsburgh. The press conference included a collaboration between the Pennsylvania Department of Correction, Amachi, and RAP Technologies to introduce a pilot program that uses virtual reality technology to help incarcerated individuals maintain contact with their children. The program builds on the existing Inside Out Dads and Parenting Inside Out program, which is designed to improve communication skills, facilitate the showing and handling of feelings, and introduce effective discipline techniques. With the introduction of virtual reality, participants learn and practice healthy parenting skills in a 360-degree environment. Each virtual reality interaction is guided by a lesson plan and managed by DOC staff, who have the ability to adapt and customize the situations in real time. Amachi Pittsburgh and Public Health Management Corporation in Philadelphia facilitated the virtual reality visits so that children do not have to travel to a prison to participate in the program. The jail has partnered with Amachi in the past, and Ms. Kroll met with their leadership last week to discuss how the ACJ can bring this program into our jail. Safety and security. On October the 23rd, correctional officers escorted an individual to the Allegheny General Hospital for a medical test. The individual was fully compliant throughout the test, and after being returned to the hospital room, officers resecured the individual to a hospital bed by handcuffing one arm to the bed frame. In the past, our policy, in accordance to national best practices, was for officers to secure the individuals in such settings by securing one arm and one leg to the bed frame for the safety of the individual as well as hospital employees and patients. However, following the passage of Chapter 205 referendum, leg restraints are no longer permitted. In this case, officers did all they could legally under the law, under the new guidelines, to secure the inmate to the bed, but the individual was able to slip out of the handcuffs and run out of the room. Fortunately, the officers quickly regained custody of the individual in the hallway outside the room, then resecured the individual to the bed. The jail is committed to full compliance to Chapter 205, but we also need to ensure the safety and security not only in our jail, but at medical settings such as a hospital. The referendum limits such actions, particularly in medical settings. As such, my leadership team is evaluating the incident to address these new challenges. Interoffice mail. The jail has ensured all housing units have been equipped with interoffice mail envelopes to ensure incarcerated individuals can reach judges or jail oversight board members. Employees of the month. We would also like to congratulate our employees for the month of October. The Employee Welcoming Committee selected Nurse Candace Johnson and Alternative Housing Coordinator April Reynolds last month for Employee of the Month. And lastly, we have not received the final report from the NCCHC suicide review. As soon as we receive the final report from the NCCHC suicide review, we will inform the board. Your Honor, that's all I have for the warden's report.
Any questions? Ms. Allen?
Yeah, so I first of all wanted to start, I really appreciated that detailed report about when you took somebody to the hospital, because we don't even get a fraction of that when you take someone for a medical emergency, when someone's dying. If that wasn't a HIPAA violation, which you just did right there, why can't we get that same amount of detail when someone has a medical emergency at the jail?
If I could point out, the detail that he provided didn't include any protected HIPAA information, didn't include anything related to the incident or the patient that you've been asking for, and that's what's different here.
I'm not asking for someone's name, but for example, if an incarcerated individual was rushed to the hospital yesterday for a medical emergency after they were found collapsed on the floor of the pod, that is no more information than when we were just given about a medical test. We were informed that there was an incarcerated individual who was taken to the hospital for a medical examination and what happened following that medical examination. We don't get any of that when there's a medical emergency. We don't get any of that when someone passes away at the jail or at the hospital after leaving the jail. Can you just please point out what is the difference? I'm never asking for someone's name. I'm never asking for their medical diagnosis. We're just asking for basic information about what's happening with the people who are incarcerated.
Ms. Holland, we just wanted to inform the board about that incident. We can look at that going forward, ma'am.
No, Warden, I very much understand that you wanted to inform the board about that incident and that's why we're hearing about it. What I'm telling you is that it is our job to be informed about every medical incident, not just this one because you want to knock Chapter 205, which, by the way, we as board members did not vote to pass Chapter 205. I proudly voted for it when I went to the polls and voted, but that was passed by the people of Allegheny County. So I'm not sure why you're coming to us with that, why you're choosing to tell us that and not when there's serious medical problems, serious lack of medical access for people in the jail and they're having medical emergencies. Can you just tell me why you want to tell us about that incident and not about all these other ones?
Again, my same answer is we just wanted to inform the board of the incident, ma'am, and we can look at the other issues in the future.
Right, Warden, because it's not really up to what you want to do. That's our duty to provide oversight. It is your job to provide us with the information we are guaranteed under the statute. So going forward, again, as we have asked at many meetings in the past, we want to be informed of any medical incident. I don't need any more detail about the situation than what you just chose that you wanted to give us about this one. But please, going forward, can you make that information accessible to us as board members?
We will look into that, ma'am.
Okay, my next question. I want to ask specifically about, so discharge and release, maybe this is just numbers, but you had said something about 300 to 400 people went through the discharge and release center, but you handed out 59 Narcan and 412 bus passes. Are you handing out multiple bus passes to individuals, or how is that number higher than the total number that went through the jail? That went through the discharge and release center. Your numbers were 300 to 400 go through discharge and release, but you handed out 412 bus passes.
I think what I said was the discharge and release center assessed 300 to 400 individuals per month, and that we gave out 412 bus passes. So that's exactly what it is. We gave out 412 bus passes.
Right, and so I'm just asking if you...
It could have been double bus passes.
That's what I was wondering.
Yes, ma'am.
So there is an option to get more than not just for you, but maybe you and a partner, you and a child, whenever you go through the discharge and release center.
Apparently they got double bus pass. Yes, ma'am.
Okay, cool, that's great, thank you. And then I have a question about one of the things that we were promised 2 months ago, and then again last month, is that we would get an update on the Reimagining the Jail, RFP. And I didn't see that in your report. I'm wondering if it's coming later in the meeting or where that's at.
We're looking to give you guys a briefing about that around in December.
Right, but we were promised that 2 months ago. So why December?
Aaron Dalton will present the reimagining of the jail in December, ma'am. That's all I can say.
Correct, but why? I understand that, but why, when you told us that it would be presented last month, and then you told us last month it would be presented this month, why would I believe that you're going to do it in December?
Because I have no control over the Department of Human Services director. She said that she would be ready in December, so I have no control over that director. December, she will give the report.
Okay, so she comes to every meeting but can't talk about it to us, despite us asking.
Ms. Hallam, Ms. Dalton has indicated she'll get a report in December.
Okay, I have another question for you. Maybe this is for the chief deputy's report, but I just wanted to ask you now in case it was you. So I was concerned about, I keep hearing reports about non-medical staff clearing the door in intake. I know you like smirk about it every time, like you just did now, but I keep hearing that over and over again, and I'm worried, especially, with the death rate inside the jail and how many people it seems had not been there for very long whenever they were incarcerated before they died. And so I'm just wondering if you can speak to why that's still happening, and please don't tell me it hasn't, because I know it's happening.
I don't believe we said that it isn't happening. What I can say, maybe I'm wrong, and I haven't said that it isn't happening.
You haven't said that it isn't happening.
Okay.
It wasn't you.
I'm sorry. But what we're doing in the jail is not doing a medical screening by non-medical personnel. We're asking some information to know about their safety and if we can accept them. It's something that is really typical across the country in many jails. So we consulted before we even considered implementing this on what the safest way to be able to do this is.
Okay, so what can you then describe what that clearing the door process looks like?
So they're asking some immediate questions about their date of birth, basic demographic. We're asking if they had a recent injury. So asking questions is different than providing any kind of intervention. So this is really common for correctional officers to be able to do that.
Are they
ask
doing
those questions? And they are later, again, asking similar questions in the booking process. So it's not any different from what they were doing then to the front.
Are they administering any sort of testing, like COVID testing, drug testing, pregnancy testing, these non-medical staff?
Those testing can be done by non-medical staff, like by scope of practice. Those are tests that routinely are performed, not jail-related, by people who are not nurses. So they're performing tests that are things that are capable to be done by a non-medical person.
Okay, and then who's analyzing those tests?
They are second signed off of and reviewed by our providers.
Okay, so
once we have the results of them.
So we have been told in the past that there is never an instance in which non-medical staff are clearing people to come into the jail.
They're not making medical decisions, correct. So that's what I'm trying to explain. They're not making any medical decisions.
So there is no medical decision being made to accept somebody into the jail? We would just take anybody if they were dying on the doorstep, you would still take them into the jail?
No, that's not what I'm not sure how to better explain this.
No, I'm just trying to understand, is there any medical clearance whatsoever that happens before someone's accepted into the jail? Because we have been told in the past many times that there is, but it doesn't seem that that's actually happening.
That does happen. There's a medical clearance before someone is admitted into the jail, but it's not done by the line staff. It's done by medical. The evaluation you're referring to is a non-medical evaluation.
Okay, what I'm asking is when people come into the jail, are they being medically cleared to come into the jail?
It's my understanding that they are, yes.
But they're not, because it's non-medical staff who are doing the clearance to accept them initially into the jail.
Are two different evaluations. One is just background information done by non-medical staff. The evaluation as to whether they will be admitted into the jail is a medical evaluation done by medical professionals.
What I'm saying is when we accept people into the jail so that they don't die in intake, so that they don't die within 24, 48 hours of coming into the jail, we are to be doing some sort of medical screening. I'm not a medical professional, but I know that that is what the jail does and what is supposed to happen. It has been being done by non-medical staff, and that's the questions that I'm asking about.
I think she just answered your question.
She did not say what you said.
Okay. Maybe I missed it.
He did use different words, but he explained the exact same thing that I was trying to explain.
So how long is someone in the jail before they're evaluated by a medical professional?
We have receiving screenings that are conducted by medical professionals, yes. And I'm not sure what you're thinking is happening
That people are coming into the jail without seeing a medical professional.
they will see a medical professional in intake.
No one, but what happens before they get out of intake and upstairs? Like in that time period where people can sit in intake for 1, 2, 3 days?
There are receiving screenings conducted by RNs in intake before they move up.
After how long, after getting to the jail, are they receiving a screening from a medical professional?
That's a loaded question.
It is not. It is like, is it an hour? Is it a day? Is it, sometimes it doesn't happen. It is not loaded at all. It's like a simple, how long is someone in the jail before they see a medical professional? How is that loaded?
Here's why it's a loaded question. Because a person can be admitted into the jail, can come into the jail and be arrested. They have to be arraigned. That takes time. That's not within the jail's control. They have to be given an opportunity to post bail. So there are a number of things that will occur before the determination is made that a person will ultimately be admitted as an incarcerated individual in the jail. So they're given an opportunity to post bail, to get themselves out of jail, so that they don't just hit the jail and then go upstairs. There's a process.
I unfortunately am very aware of the process, Judge Halsey. My question still is not loaded. From the time an individual is dropped off at the Sally Port to the time they see a medical professional, regardless of the rest of the process, how long before they see a medical professional?
It's going to vary person to person.
Correct. What's the average time? And what's the longest time?
I was not ready for statistics on that. I'm sorry. I'm not trying to defer your question.
Is it hours? Is it days? Like, could somebody go days sitting in intake without seeing a medical professional?
Days, absolutely not.
Less than 20, so nobody goes longer than 24 hours without seeing a medical professional in the jail?
I can't think of a time where that's happened.
Okay.
The rest of my team can answer and see if they said anything different, but no.
So you're saying that clearing the door has nothing to do with a medical clearance whatsoever, and that it does not matter if we have non-medical people running these tests because they're allowed to be run by non-medical people?
It is a very common practice, not even just within a jail.
Okay, and then I think the rest of my questions are for the next one. So thank you so much for your help. I'm sorry if my questions felt loaded, but thank you very much for your help. I do appreciate your answers.
I just have a couple follow-up. The use of force numbers, I know, thank you for getting it to us quick. Can you do that again for this month, or did you already say it?
Chief Beeson's going to give that.
Oh, in that part. Okay, I'm sorry. And then Amachi, I was there as well. On the pilot, how long did they say we could maybe get that up and running? I didn't hear a time on that, but that was, I think Amachi's a great organization. We have the chair sitting up here, so I didn't know if we could process that, how long that would take.
You know, we're working with Amachi and Ms. Moss to try to get it piloted as quickly as possible. So like I said, they met last week with Amy Crow, so we can try to get it done as quickly as possible.
Okay, thank you. And then last, on the NCCHC, is that, you can take that question? Okay. So I believe there was initial findings in a draft report. Can we get a copy of those initial findings in a draft report?
We normally don't give out draft reports.
Okay, but the draft and the findings in your response has at least occurred.
We received a draft.
Okay.
We have not received a final.
Okay. Okay, all right. And capital budget, last question, I'm sorry. We asked for a copy last time, because I know that, I don't think we're having the basketball hoop discussion tonight, but.
Yes, we are.
Oh, okay, we are. But just a copy of that again, if we can get a copy of the budget that you proposed for next year and what your capital was this year, your expenses, so. That's all. Again, I don't know where this falls on which report, but while I have the warden's report, I figured I'd ask that question, so thank you.
And
We're doing that.
Ms. Hallam.
We're doing it later, okay.
Yeah, can I ask, I'm sorry, I forgot that I had another question, and it was about, so there was this article that I read a couple weeks ago, and, or maybe a week ago, and it was about the prevalence of use of force against people with severe mental illness in Pennsylvania county jails. And so it reached out to all the county jails in Pennsylvania. Did you, Warden, respond to that inquiry on that study?
Not to my knowledge, no.
Correct, you did not. You were actually only one of only a handful of facilities who refused to release that information. But the article was very informative, and it talked about county jails throughout Pennsylvania and the prevalence of use of force against people with severe mental illness. So I know you have a de-escalation policy. I say that in like super hard air quotes, but do you, what else do you do to make sure specifically that use of force isn't being used against people with mental health diagnoses?
There's a lot of litigation pending on that.
Just with us, because most jails answered.
I don't have a problem with it generally, but you can't get it, I'm not going to get it. You can't get into specifics.
Oh, no, I'm not looking for specifics. I apologize, Mr. Backrack. I'm just looking for generally, how do we handle use of force against people with mental illnesses?
Ms. Hallam, generally by policy, if we have time, we engage our mental health staff to come speak with those, our shift commanders, our first line supervisors, engage the individuals, and use the de-escalation tactics that they have the training for, okay? Most of our use of forces are reactionary, meaning we don't have time to engage those personnel.
So you don't really know of someone's mental health status when a use of force would be deployed on them?
If we have personnel running in for a fight between two individuals, I don't have time to get those people involved. I have to make the scene safe, and then we can engage them.
Okay, so regardless of mental health diagnosis, if it's reactionary, like it's just everyone's treated the same?
Before they're placed on disciplinary custody or on one of the acute units, they are seen by mental health and physical health and cleared for those places.
Okay, and do we track that based off of pod, or do we just track that like facility-wide uses of force? Like, is there a way that we can see, oh my gosh, this pod, it has so many more uses of force than this pod does, or every single month this pod's the only one that has uses of force? Are we able to, do you track that at all by pod?
We have a tracking system called OnBase where we upload all the incident packets to, and I believe it can be filtered down by location, but I'll have to verify that before I give you a commitment to that answer.
Okay, and the de-escalation training has, like, there was an RFP about, that started, is that the Amachi? No, what is I remember we had talked about an RFP for de-escalation training, and,
As I reported in my report, that we began de-escalation training for our employees on October the 18th, and these individuals were trained by vendors from DHS to do this training.
okay, so we didn't put, I thought for some reason that we had put an RFP out for it. No, it was done internally?
No, that was managed by DHS. They identified a vendor who does it. I happened to be one of the facilitators that was trained under Train the Trainer. And they started in the middle of last month for the trainings.
And who was the organization who did that?
So it's UPMC's CCM training.
Okay, thank you so much. Thank you.
Any additional questions for the warden? All right, we'll now have the Chief Deputy Warden's report.
Shoot, I do have one tiny little question. I'm so sorry. I just wanted to know, if you don't mind, I promise it's easy. It's about voting. Sorry, thank you. So you said that if anybody, emergency absentee, if they come into the jail between now and Election Day, do you ask everybody at intake if they're registered to vote? Is that one of the intake questions? Is that how you'll identify them?
Yes.
Thank you.
Chief Deputy Warden.
Thank you, Your Honor. Good afternoon again, Board. I'll start with staffing. Our current cadet academy of 7 individuals is set to graduate next Thursday, November 10th. The next class will begin on Monday, December 5th, again consisting of another 7 officer candidates. On Monday, October 24th, the facility went back to optional masking for employees and the population, with the exception of the same areas the last time we reduced the requirement. Our intake department, our intake housing units, particular to 1C, 4A, 4B, any medical housing units, any healthcare interaction between medical and the population, and anywhere that positive patients are being held. The status of the suicide-resistant cells remains the same. We still have 7 of the 10 complete. As I reported last month, there is a contract extension in place, but no time of arrival from the vendor yet. Like I said last month, their home office and supply warehouse were severely affected by Hurricane Ian. 300 Bs in the facility, currently 53 individuals scheduled for transport to the DOC. Of those 53, 48 are scheduled for transport to either SCI Green or Smithfield during this month, during November. The October 2022 use of force numbers were 21, and a basketball hoop was installed on Pod 5MC for the juvenile population. And that's all I have, Your Honor.
Any questions? Ms. Howell?
Yeah, my first question is, when was the basketball hoop installed?
Friday, October 28th.
Just this Friday? How's it going so far?
I did a video review when I got back to work on Monday of the weekend, and it wasn't used. I did observe some juveniles using it this afternoon.
Awesome. Thank you so, so much. I know it might not seem like a big thing, but to them it is such a big thing, so thank you for...
The delay was facilities, the tradesmen trying to find an area where they could mount the backboard in the rim where it didn't interfere with the electrical conduits, the piping, the lighting, the sprinklers, so on and so forth. So they had to find an alternative method to anchor it to the wall in a particular place, but they got it completed.
Awesome. Thank you so much. Okay, I have a couple more. So the first one is, so I was waiting, I didn't hear anything about, I know I read like a press release from the jail talking about, well, 2. First of all, today, MAT being expanded, methadone. Sorry.
Why are you taking my thunder?
I never, is that coming later? Oh, I thought we were done with this whole section. So then maybe I should just wait. I'm just going to wait for the rest of my questions just to make sure.
I had really good news, and you just told
I'm so sorry. I read nothing about MAT at the jail.
That's all I have.
Perfect.
I'm moving on to Dr. Brinkman, and then Deputy Toma has.
Okay.
Any additional questions?
Then I'll wait for that. Sorry.
Dr.
Sorry, real quick, on base, you said you were reporting incidents.
The incident tracking, yes.
Tracking, is there a way to provide more detail? And I'll shoot you an email with detail, not names, but what type of force, various things like that. Is that
As I stated to Ms. Hallam, I believe there are ways to filter that down, but I have to verify that. I have to check the system.
Do I ask you staffing questions or no, wait, healthcare staffing questions?
I do not have numbers on healthcare.
Dr. Brinkman.
Sorry for the confusion. All right, so I got my typical COVID report. Infection rates and testing, incarcerated individuals, the total amount of incarcerated individuals tested for COVID during October was 1,706. Of those, 36, or 2.29%, were found to be positive. There are 7, that was an old number. I have the wrong number for current positive, so I'm not going to give that to you, but we don't have anyone hospitalized. For employees, we have had 322 staff reported positive results, presently with 7 individuals continuing through their process, the recovery process, and not yet returning to work. Vaccination updates. Last month, we reported that we had 592 individuals with the full vaccine series. This month, we have 622, or 45% of our incarcerated individuals with a full series. Medications for opioid use disorder and the expansion of those efforts. For our continuation related to naltrexone, we have 17 individuals prescribed oral naltrexone, 2 receiving the Vivitrol injection prior to release. 93 individuals were treated with Suboxone and 10 treated with Sublocade. As promised at our last JOB meeting, our work with TDISO was truly approaching the final stages. We scheduled a soft rollout of services that began for the continuation of methadone treatment for all patients as of Monday, October 24th, and I'm ecstatic to report that we've served our first non-pregnant patient last week, and we are now up to 8 patients. I skipped through a lot of that, but that was the important stuff. Okay. We're currently reviewing patient needed resources and the implementation processes to determine the next stage of expansion for medicated-assisted treatments in the facility. To support overall medication-assisted treatment for all substance use disorders in conjunction with our AHN partners, we've posted a position for advanced practice provider intended to specialize in substance use treatment and other conditions associated with substance use. Should you or anyone that you know have experience for and passion to serve this population, please visit AHN's career website to apply. Shameless plug. For Torrance, during the month of October, 1 patient was admitted and transferred to Torrance State Hospital. 12 patients were committed to Torrance State Hospital. Currently, 26 patients are awaiting admission to Torrance State Hospital, with the longest waiting since June 10th of 2020. As an addition, during October, 1 patient had their commitment to Torrance for competency restoration rescinded due to clinical stabilization. Knowing that these wait times have been an ongoing issue, we've worked with pretrial services, the courts, the Department of Human Services to draft a request for proposals to add mobile competency support teams in our county. So DHS will be managing that RFP and the lead in all of that. So any follow-up information, they'll have more details than I have. I just know that it's out. They've graciously offered to field those questions. We're in early stages, but I wanted you to know that that's something on our radar and we're trying to work on. For Tier 4 and 5 data, in the month of October, 0 individuals were identified as Tier 5 in the mental health tier system, and 6 unique individuals were identified as a Tier 4 in the mental health tier system. As of today, our sick call requests in medical have a total of 53, with the longest waiting 26 days. The SCR mental health reports, mental health have eight patients with the longest waiting of 3 days. Psychiatrists have 191 with the longest waiting 8 days, and mental health specialists have 8 with the longest waiting 4 days. I have a few details in addition to my normal report. So for the NCCHC historical review of fatalities, I know it was discussed last month about what the need would be for a third-party review, and I wanted to provide some information on the practice across healthcare disciplines, not limited to correctional settings. The primary health-related accreditation correctional facilities can obtain is by the National Commission of Correctional Healthcare. The accrediting body has an affiliate organization called NCCHC Resources Incorporated, which supports facilities being able to apply standards and reach overall best practices. For that reason alone, I'm incredibly grateful that the county executive and his office chose to contract with NRI for the review of fatalities, which will be immeasurably helpful as we prepare our organization for future accreditation. Most healthcare facilities will practice what is called either a mortality or morbidity review for a clinical perspective, not only from an oversight perspective. So it serves as a continuous quality improvement tool, an educational tool for practitioners, and an administrative tool for process improvements. As an improvement tool, it's not only to identify issues, but praise successes. Standard mortality reviews are conducted by objective clinicians, meaning persons with demonstrated experience in the clinical area who have not been involved in the treatment of the identified patient. NRI is currently visiting. They just left this afternoon. With a team that includes a correctional expert, a physician, a behavioral health expert, and then their lead surveyor. It's been a pleasure participating in the process NRI has been using throughout the review to learn from their approach for mortality reviews. What will be most helpful from this historical review of fatalities is the ability to identify trends over years, not just from the immediate memory of cases. Our interdisciplinary patient care pilot program, our initial expansion of this program was tested originally in August, began this month in October. The team began a soft rollout while continuing to plan for elements to the model. You may have noticed, skip that one. As we are too familiar with staffing concerns, I wanted to be clear that myself, the warden, and our administrative team that here and not here are committed to continuing healthcare department mission of serving patients. In order to do so, I'm continuing the variety of initiatives that we have and that we're discussing in this soft rollout approach to ensure that we can still have growth despite limited resources. So a silver lining that the pandemic did bring us was the constant reevaluation of practices to identify more creative ways to deliver our services. In doing the reevaluation, we took feedback from our current staff, other facilities, and healthcare entities who were faced with similar staffing shortages. While individual staff have a limited capacity for the work they do, the management of the workload have many opportunities. Thus, are redefining the structure in our health service delivery model. I provide this background information for a couple of reasons. So when the warden has spoken in the past, making statements, we're doing everything in our power to address staffing issues, he hasn't just been speaking about recruitment issues. None of us in healthcare are very good at bragging about the work that we do. So that has landed us in this place where there's a belief that we do nothing. We're trying to change how we communicate to the board, and that's why I have a much more detailed report this month, and to the public, so that the details of the entire picture are a bit clearer. So the project itself, the interdisciplinary approach, is not a new idea. However, applying it in the way that we are is what's new and somewhat new to us. This began our analysis of how we deliver healthcare services and what the best delivery system will be. So some highlights of the outcomes seen from the pilot include 117% increase in the nurses' completion of sick call requests. So I have to say, this was an exceptional nurse to begin with, and she increased it by 117%. That was impressive to me. Additionally, the redesign in her role reduced the number of patients needing referral for other services. So only 16% of the nurses' patients required referral for increased services, whereas prior to the pilot, 100% of them would have been referred up. Overall, the provider appointments decreased approximately 20%, and that was in 1 month alone. And referrals for further evaluation reduced in wait time down to the same day of that initial evaluation from the provider. So I wanted to give you a little bit more detail on that, and those are some of the outcomes we've seen. We expect to extrapolate much more now that it's going throughout the building. I have some new business also. Behavioral health staffing is currently a major focus we're working to resolve. We're experiencing a wave of turnover in our provider team. Collaboration with our AHN partners reaffirmed how difficult recruitment has been across the country and behavioral health specifically. While the current staffing level is not ideal, we have identified strategies to manage patient needs. Our plan to address coverage includes the additional uses of telepsychiatry, increased supervision from AHN psychiatry, the onboarding of new providers, and the continued interviewing of candidates, as well as additional recruitment strategies being developed among county HR, marketing, and as well as AHN's recruitment and marketing. So I wanted to add a new standing item on my agenda for the report of healthcare successes. My healthcare team works incredibly hard, and because of HIPAA restrictions, we've not always found ways to share those successes with the board. Moving forward, I'd like to take the opportunity to highlight these. Whether this be a staff accomplishment or a generalized patient accomplishment. These highlights will never violate any HIPAA-protected information, though I find it very important for you to have some more information. I gathered input from our healthcare team to identify successes. For this month, I'm proud to report that staff of all disciplines across the department completed 3,156 sick calls. This is only one snapshot of each team member's responsibilities, but over 3,000 patient encounters within 1 month is significant in any pie, no matter how you cut it. Also this year, our flu vaccine clinics have begun. We announced October 7th to our patients that they were going to be available, and our first clinic allowed for 60 patients to receive vaccinations. Thank you for amusing me with that addition. But I also wanted to point out A small group of our healthcare administrators attended the Fall National Conference to NCCHC. This conference not only presented on current correctional healthcare issues, but also serving as an opportunity to consult on policy development and implementation of standards. With our department working toward accreditation soon, we have come back with a wealth of knowledge for ACJ. Areas we found most helpful to include new practices for health service delivery models, training areas to support our staff, and new ideas to meet a variety of patient needs. We found it to be incredibly valuable in our ongoing work for improving care. I know you got questions, so what's up?
Any questions?
Just on the patient floor by floor that you're going to, and obviously the numbers grew, was it 117% more? Who is on the team on each floor? So is there a licensed doctor, a licensed professional?
Sure.
Yeah, what does that team comprise of?
So each of the floors have an LPN or an RN. It depends on the staffing complement for each of those.
Okay, so I came from city council, so LPN.
Licensed practical nurse.
Okay, got it.
Or a registered nurse.
Registered nurse, okay.
We have advanced practice providers, which would be either a nurse practitioner or a physician's assistant. One of our levels does have a physician on it. It's a more complex level. We have, where we can, put in behavioral health staff as well, so mental health specialist or provider.
So there's usually 3 people per team.
3 to 4. Plus
And there's, oh, go ahead.
No, I was just going to say, plus we have input from the custody staff on those levels.
Okay, and then there's staff, so how many hours are you on each floor? Is it roving throughout the day?
Like I mentioned, being a soft rollout,
Yeah.
what they're doing currently is at least 1 2 to 3 hour clinic a week. So then we hope to be able to expand.
And that goes to the staffing overall issues of the low staffing.
Right.
And then there used to be a nurse's station on each floor. So is that what the overall plan might be, or just continue to rove?
So what we did was we took our triage rooms that our nurses administratively use, not necessarily with patients, and we turned those into a mobile clinic, so to speak. So it's outfitted with medical equipment and things like that, so that the patient can be brought to that room on the level.
Okay, so when we did our tour last week. So, okay, if they're roving and they're on the 3rd floor, does somebody still, I assume they'd still have to go up to 5 to get, everything is right there.
Everything is right there unless it requires some kind of invasive evaluation or treatment.
And then that person would
that's
be taken
right.
upstairs.
And those are
then
the
back down.
referrals I mentioned were reduced down to same day.
Okay, so what would your numbers be then to get this fully on each floor? What would you, I mean, I know that's a staffing question, and I hope it wasn't a loaded question.
No,
but,
I mean,
but basically,
a little bit, but.
Yeah, it was. But basically, you need another X amount. So this would be on every floor. And I understand the specialty on the 5th.
Right,
but
right.
in order to do this.
So I would like to see at least another 2 providers, as well as at least 1 to 2 more nurses.
Okay. Okay, good. Thank you.
Ms. Allen?
Thank you. Okay, I have a couple, a little more than a couple. Okay, first thing is you talked about the NCCHC death investigation. So what kind of documentation is the jail providing to, and, because you called it something else, right? NHC Resources Inc., NSI? Or NRI.
NRI,
Duh,
yeah.
it was right in
So
front of me, yeah.
NCCHC is the accrediting body, and they have an affiliate, which is NRI. So they're the ones that do any of the consultation.
Okay, cool. So what type of documentation are we providing to NRI?
Everything they've asked for.
Okay, unlike the jail board. You don't need, that wasn't a question, you don't need to answer that. Is the documentation that they're asking for similar to what the jail already compiles when you do like an internal review of a death in the jail?
Some of it has been, but like I mentioned, it's been really nice to learn from how they're doing the review, so we can always do our own process improvements too.
Okay, and will the board be provided with the same information that NRI is provided? Will we get access to that same information?
I can't give all of the information to the same extent because of the protected information.
Okay, but they're getting the protected information? People outside the county, outside the jail board who aren't statutorily authorized to get it, they're getting it?
It's part of the contract that was written in that allows them to get that information without violation of that. That was part of the contract.
Right, but we, as a jail board, have a contract with Pennsylvania that says that the jail board is authorized. I mean, I can read it to you, what the information that we are authorized to get. I mean, the board shall, and this is directly from Title 61, right? The board shall investigate allegations of inadequate prison conditions and improper practices occurring within the prison. It may make such other investigation or reviews of prison operation and maintenance. So what is it that they're allowed to do that the statute doesn't already authorize us that we have to do?
There's a provision in HIPAA that would allow this organization to review that data as part of an affiliated organization for that, and there's a contract, and there's provisions in the contract that provide protection for protected information. That's why they have the that's why they have the information.
So do government contracts supersede state law? Is that like the balance there?
I can answer why they have the information.
Can you answer why we don't have it?
No, I can't.
Okay.
I'm not going to get into that issue.
Okay, cool. Okay, next question. Oh, the results. After the audit is done, I don't know like what the timeline is. Do you have a timeline on when that's going to be done?
I don't have a full timeline for the final report now.
Okay, and will we receive, as a board, receive the report when it's finished?
We had already discussed doing that, yes.
We will, okay. Can you just update us like when you know as it's coming, as it's getting closer? Thank you. And then the next thing is speaking specifically, and I know you have said a million times, like if Yins could hire 1 million more healthcare staff, you would, I totally understand. But currently, how many medical doctors do we have working in the jail?
We have 2.
2, okay. So the like staff to patient ratio is like, what's that, like 1,500 to 2? 750.
The 2 physicians are not the only providers, though, so they're supported with 7. The physical primary care team is supported with 7 advanced practice providers, which would be your nurse practitioner or
And the
your
PAs.
PA.
Okay. And then has there been anything, I know there was like some chaos recently about a medical doctor who left the jail. Is there anything that the jail is doing regarding verifying licensing and I guess resumes that we're providing, credentialing of medical professionals that come into the jail now since?
All of the credentialing AHN completes. So we review for security purposes, and AHN, as the employer, does the credentialing.
And has there been any ramifications between the jail with AHN as a result of the most recent incident with?
Do you mean regarding our partnership?
No, regarding like Wilson Bernalis' employment with you.
I can't speak to their personnel issues. I'm sorry.
Okay, so basically if AHN says it's cool, there's no second like check on that if AHN says this is a legit doctor, this is a legit medical professional, like we just kind of take their word for it and hope that they did it right? It's okay if that's, I mean, it's not okay, but if it's a yes, yeah, you can just say that.
It's a yes.
Okay, thank you. And then are there any duties, since I understand we have other medical providers other than just the medical doctors, but what are certain duties that only a medical doctor can perform? Like, are there certain things that the other advanced APP can't do that only a medical doctor can do?
They're their extender. Sometimes they're referred to as extenders, meaning that they can, I can't think of one off the top of my head they can't do, but it's always under the supervision of the physician.
So, but there's the physician isn't like touching every patient, right?
Right.
Yeah, so are there things that have to be supervised by a medical doctor?
Yes, that's why we have the 2 physicians supervising them.
And so if there's only 2, and I see that we actually want 4, right? 4, is that why there's 2 vacancies? 2 plus 2.
So,
like, what's the ideal number of doctors?
2 plus our medical director.
2 plus the medical director. Okay. So it says there's 2 vacancies in physicians right now.
One of them is a locum. So locum referencing a contractor who is not a permanent employee.
Okay. So is there always a medical doctor on site?
No, that's a part of why they have their extenders.
Okay. But there's certain things that have to be supervised by a medical doctor.
So according to the law with their credentialing, they have to be within phone contact. So they need to have immediate contact with them, which our physicians are available to their APPs.
Okay, cool. So even if they're not on site, like those 2 doctors are always answering the phone for the APPs, the extenders.
If they need to
If they need
consult
to.
or, yes.
Okay, cool. Thank you very much. And then regarding, so you did answer, I think Controller O'Connor asked a couple of the questions I had about the specifics of the interdisciplinary patient care program. Aside, like that's awesome to have them on every floor, but can you talk about like what is happening now other than the medical providers being on each level for different shifts? What is different about this program than previous medical care that was provided at the jail?
So it was trying to restructure how we delivered it. It's not that we're delivering different care. So for example, there is one designated provider for the subgroup of patients, which means one provider consistently gets to know and treat those patients. Continuity of care immediately increases when it's only one provider taking care of them.
Okay, so that is the change, is that there's going to be the staff on each level.
Yeah, so you have one team that's overseeing it.
Okay, all right. I was just wondering if there was like, I know that that's not a big deal. I'm not trying to minimize that. I'm just saying, is there anything else that's different than what we did before other than that?
It's formalizing the things that we did before. So we're adding treatment teams to review that patient population, whereas before people were kind of operating separately.
Okay, and then does that change, does this new interdisciplinary patient care program, does this change at all how like meds are distributed? Like, is there still like a nurse that goes around to all the pods and gives out medication, or is it like each floor has their own team that's giving just their floor's meds?
Medication's not been changed.
Not changed, okay. What about the sick call system? Has it affected the way that
Yes.
it has?
Yes. Oh, I mean, it means that that's the primary people who are responding. I hope that answers.
Okay, yeah, no, that does. And then speaking of sick calls, how do you track, like I know if you put a sick call through your tablet, and that's how, I assume how you're getting the wait times for sick calls, is by tracking like when they recorded it in their tablet and when they got seen. But what about verbal requests for medical attention? Like if someone's in their cell and they hit the button and ask the CO to see medical, what about people who don't go through the tablet system and verbalize their need for medical attention? How do you track that?
I think that was one of.
So it's tracked by the correctional officer getting the call from the incarcerated individual, and the correctional officer letting medical know about the encounter. And it's our expectation that the correctional officer is notating it in the logbook. That's the only way that we're tracking it, is notation in the logbook.
Okay, so anytime someone in their cell asks for medical attention verbally, it's annotated in the CO's logbook?
Anything of an unusual nature should be notated in the logbook to include any calls to medical for medical issues, yes.
Okay. All right, thank you. And then next question was about the expanded MAT. You know I'm thrilled about that. I don't need to tell you about that. I can't wait till we start induction. That's what I'm really excited for, is like getting people on methadone and starting that service in the jail while we have them, and then hoping that they continue it after they leave. But I know that's coming because you've said it's coming.
I told you that's why we're evaluating what's the next phase.
Cool. That's what I hoped you meant when you said next phase, so thank you for that. So is that the case for, so now that this is implemented, anyone that comes in with a prescription for any MAT gets some sort of MAT?
Of all the forms I'm aware of, yes.
Okay, awesome.
Just making sure I'm not thinking of something.
No, that sounds like the case. I just wanted to make sure there wasn't some section, like if somebody comes in on, Suboxone, they're like, oh, you can't do that, or someone comes in and we switch them to something else. That doesn't happen.
Some of them have eligibility criteria, but it doesn't it's all for continuation purposes.
Okay, great. And then also, when it comes to, I know you said that you're working to hire an advanced practitioner for, I guess, to be responsible for that, but in the meantime, who's administering the methadone?
That's all, so the hiring of the advanced practice provider is related to someone who would be overseeing all but methadone. Methadone is specifically contracted with TDISO.
So TDISO does everything?
TDISO's doing everything.
Oh, okay, so like the officers at the jail, they don't need to be trained on policies, procedures around methadone because they're never going to administer it?
They're not administering now.
Okay. Oh, okay. And do I have any more questions? No. Thank you.
Any additional questions?
No, just a couple things. Actually, I have a couple motions because I have to leave, unfortunately, and I apologize to some of the speakers. I misunderstood when public comment was going to be, so next month's meeting, donuts and snacks on me, so I owe everybody in the room. Are you guys going to put in, I know this is just a pilot, but are there going to be standards and policies that you're going to write up for this if it goes full-time, the floor-by-floor program?
We'll have procedures.
Okay, policies and procedures. And can we get a copy of that when you guys develop it? I know it's in a pilot program now. Okay, thank you. So, two things.
Yes, for the minutes.
What'd you say?
I said yes for the minutes.
Okay. Not policies and procedures. So the liaison position, I know we got 42 applicants. We do need to make a motion to close out the, what would I call it? The bids, the application process. So November 10th would give us 21 days. It's past 21 days, but motion to close the application process on November 10th.
Any second?
Second.
Okay.
All in favor?
Aye. And then second, for the
Any
board.
opposed?
Oh, sorry.
Motion carries.
Sorry, Judge. So also for the board to know this, my staff is going to be staying for public comment. Unfortunately, I have to leave. But also my staff, Encore, who's met with a few board members already, is putting together, and I believe we need this, and it's a further conversation for our subcommittee, but the liaison position, I believe, needs an MOU with the jail for access, for other things that they are going to be doing. So we will help work with that. We do have a draft that we'll get together with our subcommittee soon, but just wanted to mention that. Of course, I did give the sheriff knowledge of that as well, because the individual, whoever's hired, is going to be in his office as well. So just wanted to end with that, but thank you, and again, I apologize, I have to be somewhere else.
Deputy Tuma?
The Allegheny County Health Department has inspected the Allegheny County Jail 5 times this year under their inspection program, most recently on October 26th. They inspected the jail as a result of a request by the jail under our food safety program. On October 23rd, we received a complaint regarding meal trays at breakfast time. 3 trays were preserved, and the Allegheny County Health Department food safety program was notified. Those samples were submitted to the Allegheny County Medical Examiner's Office for analysis. Their report reads as follows. Food analysis for items 1 through 3 were food containers holding cooked oatmeal biscuit portions. Brown solids from the oatmeal were sampled and examined microscopically and or chemically. Biscuit portions were not examined. A powdery brown solid present in items 1 through 3 were consistent with ground spices. An example of ground spice is cinnamon. A second dark brown solid present in items 1 through 3 was consistent with carbohydrate material. Additionally, at the time the samples were collected through the Allegheny County Health Department Food Safety Program, they conducted an inspection of the food source locations for which the meals were prepared. The food source condition or the cleanliness of the area was rated as satisfactory. The pest management was rated as a medium risk. And a corrective action plan outlined by the health department was implemented to include targeted cleaning and is continually being monitored to this day. In regards to the list of educational curriculum, Juvenile education services at Allegheny County Jail provided by the Allegheny County Intermediate Unit conclude the juvenile education program is mandatory for those juveniles who are classified as adults by the Court of Common Pleas and under the 18 year of age. A full high school daily schedule runs from 8 a.m. to 2:20 p.m. in Level 1 in the Juvenile Education Department, and all juveniles are expected to attend daily. Courses that are offered and designated using the Pennsylvania State Curriculum Standard Guidelines. Lessons are infused with diversity, equity, and inclusion principles of learning. Culturally responsive teaching methods integrate cultural content awareness to enhance achievement for all students. Trauma-informed practices are used that recognize and respond to behavioral, emotional, relational, and academic impact and traumatic stress. Credits earned are applied towards an individual's community school diploma. The ACJ works with an individual's community school to see if they will accept credits and issue the community school diploma when the proper number of credits are obtained. School districts we have partnered with in the past include McKeesport and Steel Valley. If a school district is unwilling to accept our credits, Pittsburgh's Brashear High School issues the diploma. When a student in the juvenile education program turns 18 and is not special education student, they are offered the opportunity to enroll in the adult education program. If a student turns 18 and is in special education, we are obligated to continue to provide education services until the age of 21. Teachers go to the individual's housing pod weekly to work with them on a one-on-one basis. Adult education services as requested. These services are provided to any offender 18 years of age and above. The primary goal of an individual enrolled in an adult education program is for them to attain their PA Commonwealth Secondary High School Diploma, formerly known as a GED. There are 3 sections in adult education, and each enrolled person is administered the TAB Education Assessment Test to determine where a participant is placed. The first section is ABE level, meaning the individual tested at the 5th grade level or lower. The pre-GED levels mean that they tested at the 6th or 8th grade level, and the GED level means they tested at the 9th grade level or above. Testing is administered after every 50 hours of classroom time to determine if the individual has made the necessary gains to advance to the next level. The GED program is administered at the ACJ when successfully completed. A PA Secondary High School Diploma is awarded. The jail offers computer literacy program. Participation in this program provides individuals with basic computer knowledge in Microsoft, Excel, Word, and PowerPoint. Workforce skills are incorporated, helping participants to develop resumes and interview skills. The jail also offers a pre-apprenticeship program. This math-oriented educational program prepares participants for an individual apprentice exam, electrician, plumber, ironworkers, etc., which is the first step in getting into an apprenticeship program. In regards to the RFP for the contract for commissary, negotiations have completed. A final version of the contract has been submitted to the solicitor's office for review. Once it is approved by that office, it will be circulated for signatures. No signatures or contract has been executed at this time, so I have no further information on that topic.
Any questions? Ms. Howell?
Thank you. I have a couple. So I appreciated the update on the health department inspection, but it was weird because you left out what I think are the most important things. So the comments from this October 26th inspection, rodent droppings observed in dry storage area of kitchen in the back areas, clean combers and below food shelving to monitor. Rodent droppings observed in walk-in freezer that is holding dry goods such as the dry oatmeal you referenced. Clean and monitor. Seal any gaps around edges. Eliminate pests by approved methods. Eliminate harborage area, food sources, and entry sites. Clean and maintain. Remove rodent droppings. So, you know, I think it's important that if you're going to provide.
I don't disagree, Ms. Hallam.
Thank you. And so has any of those corrective actions taken place yet?
Targeted cleaning was administered. Those areas have been monitored to monitor, activities since the inspection was conducted. The request was placed to have the location sealed. Food areas have been cleaned, and again, pest management, eliminate pest approved methods, and again, we addressed it with our pest company. Traps and baiting are still in place.
Okay, thank you very much.
Any additional questions for Deputy Clerk?
No, just like when is the point in the contract process that we will get it?
As soon as the
When it's
signature is
signed.
applied by the vendor, we will notify you.
Okay, thank you.
I believe it might be time for public comment.
There's still one
Oh,
point on
Legal
here
Department.
from the legal department.
Mr. Backrack, that will be you. Responses to questions regarding the Summit commissary contract.
I don't have anything to report about that.
Why not?
I don't have anything to report.
Okay, well, I do have a question for Mr. Backrack. What legal action do I, as a board member, need to take in order to compel the county to give us those documents that were referenced earlier?
I can't give you that kind of legal advice.
Okay, because that actually brings up a really good point is Mr. Backrack is not our attorney. It's actually, I think, a conflict that we don't have our own solicitor or attorney for this board.
I think Deputy Tuma can speak to some of what you're looking for.
The legal process?
No. What documents are you referring to?
The documents that are being handed over regarding death investigation, causes of
so
death.
you're not referring to the RFP, you're referring to...
Correct,
you were
I've
referring to
jumped
the
back since I was waiting
commissary.
for the legal, thing. But yeah, so Mr. Backrack can't give us legal advice on how to take action against the jail for not giving us information that we are obligated to get. So I just kind of wanted to like put a feeler out there for us to potentially get a solicitor for this board, because I do think it's a conflict of interest that the jail has like this whole team and their legal representation, but we don't have anyone to stand up for us and the incarcerated individuals.
I'm not sure what information, you're referring to information regarding the deaths in the jail?
Yeah, I'm just wondering what legal action I would have to take as a board member in order to get the jail to follow state law.
But didn't you receive the information by way of an executive session regarding the deaths?
No, if you remember, I was told that I would need to subpoena those documents if I wanted that information.
No, what I remember was that you were given we were all given detailed information regarding the last 17 deaths in the jail in an executive session.
And the lieutenant told me that if I wanted information about the investigations of those deaths, that I would need to subpoena them. And so I'm just wondering, since we have legal here,
How would that attorney?
Exactly. It couldn't happen because it's a direct conflict for the jail to give me that advice on how to sue them. So I'm just wondering if we can put feelers out there about how does everyone feel about starting to look into the idea, not committing to it now, but start looking into the idea of us obtaining a solicitor for the Oversight Board. Having the county's legal team be the only legal authority in this room just doesn't work. It's a conflict.
Anything else?
I just want to know how the board feels about it.
It's not on the agenda, it's not a motion. Is there anything else?
Well, there was Allegheny County Legal Department, so I'm asking a question.
Right.
I'm sorry, Mr. Backrack, do you know how the Jail Oversight Board could obtain a solicitor? Will we need to go through the county? Is that the official process?
I'm not in a position to give you legal advice.
Right.
No, I know.
Correct. So that's the problem that I'm trying to solve here, is where do we get legal advice from if it's not Mr. Backrack? Does anyone?
I don't think anyone has an answer for you. Have any other questions you'd like to ask?
No, that's the only one I had for Mr. Backrack. Although I would like those responses, since they were on the agenda, if you could prepare them for the next
What response?
meeting. Allegheny County Legal Department responses to questions regarding the Summit commissary contract. I believe the questions that were asked were why the contract was not terminated as a result of them violating the contract and charging exorbitant amounts for commissary. We had asked at the last meeting for you to come to this meeting and tell us why it was that we stayed in a contract that should have been voided for breach. And you didn't bring that. Can you bring that for the next meeting is my question. It's on the agenda, sir.
Solicitor about that, that's much I can predict.
Okay, Ben, can you bring us that report back from the solicitor then?
I can talk to the solicitor.
And come to the next meeting with a report back?
I'll be at the next meeting.
Thank you very, very much. And that's all I have, sir.
All right, we'll now hear public comments. I just want to inform you that there are 3 sheets of people that have indicated they'd like to give public comments, so we want to give everyone an opportunity to be heard. We'd ask that you limit your remarks to 2 minutes.
Judge Halsey?
Wasn't it 2 minutes? My apologies, 3 minutes. Forgive me, my apologies.
Also, I want to say two things. So first of all, I did forget to object at the beginning of the meeting to Mr. Pilarski voting illegally, so I did just want to get that in the record. But also, we've moved public comments, and we talked about the last meeting how it's not really fair for members of the public to have to be here by 4 p.m. or else they can't sign in, but then to have to sit here till 6, 6:30, 7 o'clock to speak. All of us have to be here for the whole meeting regardless. They used to come at the beginning. Why did we change the agenda?
Because it's the hope that when the deputy warden, chief deputy warden, and the warden give their report, that some of the questions or concerns might be addressed, instead of doing it the other way. So with that being said, we're now...
Judge Housey, that does not happen, first of all. And second of all, forever, your argument is always, this is the way we've been doing things. But that was the way we were doing things, forever. And you just changed it last month, and you said the reason was because people had to leave early. But now we're back to the next month, and it's still down there, and we're still making people sit here for 2 hours.
Okay. So public comments will still follow the warden's report and the deputy warden's report, because the hope is that the information they provide might address some of your questions or concerns. So with that being said...
But then wouldn't it make sense for them to ask the questions first? I don't understand what you're arguing.
I'm not arguing. I'm not arguing. I'm about to do
But you
public
also
comments.
didn't answer my question.
And I'm not. So now we're going to do public comments. The first person on the list is Thomas Hoffman. Mr. Hoffman, you have 3 minutes. Please, if you would, please state your full name for the record and spell your last name if you don't mind.
Yeah, sorry. Caught me by surprise there. So my name is Thomas Hoffman, Hoffman, address 7115 Willard Street, Pittsburgh, PA 15208. And I'm here to comment on the book situation at the Allegheny County Jail. I'm here on behalf of a community member that couldn't come at this time, although maybe since it's so late, maybe they could have made it by now, but who knows, who is fed up with Judge Housey ignoring written public comments and refusing to read them. These meetings times are not accessible to those who work 9-to-5 jobs, and accommodations need to be made to encourage public participation. A recent right-to-know request provided a list of books rejected for lack of receipt or because of content. I have several issues with this. First, there are many books that I and others have attempted to send in the last 2 months that are not on that list. This includes books such as the graphic novel Mouse, the United States Constitution, and of course, Run and March. Books banned for content include a self-help book written by a U.S. veteran. This is clearly an over-aggressive censorship and a thinly veiled attempt at a total book ban. This is shameful. Second, this list contains no dates. People have reported that their books are not being returned to the shipper when rejected, which results in a delayed or no refund. Are these books that were provided on this list simply a collection of the books sitting around the jail waiting to be returned? Many people, myself included, have spent hundreds of dollars on books that are likely gathering dust in the warden's office. This is shameful. The Allegheny County Jail needs to end this ruse and allow people to receive books without these increasingly outrageous barriers. They need to answer to the families still awaiting refunds. Thank you. Thank you.
Forgive me if I mispronounce any of your names. We'll hear from Arlen Hess. And Ms. Hess, I just want to point out, although it is required for you to give your address on the sign-in sheet, you do not have to state your address for the record.
Okay.
Thank you.
Well, I'm happy to state the address of the bookstore. In light of the establishment, my name is Arlen Hess, and I am the owner of City Books, which is Pittsburgh's oldest existing bookstore. It was founded in 1984, and since Councilwoman Hallen and the board has now established a subcommittee, I am going to limit my remarks a little bit. a little bit. I'd like to say that independent bookstores are fundamentally better suited to supply books to incarcerated people than national chains or big box stores. Reading teaches empathy, complexity, how to face shame, and how to build personal dignity. These findings mean much more to local citizens than to a corporation registered in Delaware. Not only does the tax money return to the city, the business's investment of time and effort reinforces the social contract. When small businesses supply resources to their incarcerated neighbors, we exemplify the qualities of good citizenship that become necessary for a successful transition back into the community. Our accountability is much higher because we share space and rely on the consideration of our neighbors to remain in business. If we misstep, the consequences can be disastrous. I understand that credibility can be an issue when approving book suppliers. While I was sitting in the audience, I checked that the top 4 people that are on the list that Ms. Hallam presented, and Riverstone, not Classic Lines, are all members of the American Booksellers Association and the New Atlantic Independent Booksellers Association, so we have to pay to be legitimate. In addition to being repeatedly covered in the media, many of us have also been featured elsewhere around the country in other outlets. For example, City Books has been featured in the Kenyon Review, on Forbes.com, on C-SPAN, and in 2019 was named one of the best bookstores in the United States by Mental Floss magazine. City Books is already a trusted supplier of books to correctional facilities in the tri-state area. From April to July of 2021, we spearheaded a book and fund drive on behalf of Renewal Center that allowed us to establish a library of about 1,800 books. And when Schumann closed, I worked with Jay Moser, the high school principal at Schumann, to distribute those books to other organizations for at-risk children throughout the city. As a result of the press that City Books received for building the Schumann Library, we developed direct relationships with incarcerated people at SCI Green and the Northeast Ohio Correctional Facility, currently fulfilling requests by both phone and mail order, and I talk with incarcerated people at the Northeast Ohio Correctional Facility at least twice a week. So, on both personal and professional levels, I support Ms. Hallam's effort to ensure prisoners' rights to access of books, and I would be happy to address the newly established subcommittee on local acquisitions moving forward. Thank you.
Forgive me, but this next name, I believe it says Beth. I'm not even going to try the last name. Something with an S and I'm sorry. Shangar, Beth Shangar. Forgive me. You're up, ma'am.
My full name is Elizabeth Schongar, Schongar.
Thank you.
To get right to the point, a new study published in the Journal of the Society for the Study of Addiction on October 28th, 2002, so this is right off the press, finds that incarcerated people had a massive 50% reduction in overdose deaths in the 2 months post-release when receiving jail-based MOUD, otherwise known as medication for opioid use disorder. Now, we've already heard some things about that this evening, but it's still very important to realize just how important it is to be doing this. In the opinion of Dr. Joseph Friedman, researcher at UCLA, offering this life-saving treatment should be mandatory for jails and prisons nationally. Why is this treatment so important? The highest risk time for all addicts is if they are released from a jail or prison after cold turkey forced detoxification. Their body is no longer accustomed to drugs. Reliable contacts may be lost. They may not have money for good, reliable drugs. So this is the most vulnerable time for addicts. Most likely time for there to be an overdose. There were 719 opiate deaths under the purview of the Allegheny County Medical Examiner's Office in 2021, and we know that many of the addicts in the county cycle through the jail MOUD in Allegheny County Jail could make a huge reduction in overdose deaths in our county. Now, this is not to insult what you folks have been doing and are continuing to do. It is rather to lend my voice in support and to indicate the urgency. We got good news today. The jail program just expanded to allow people to continue MOUD, both methadone and buprenorphine. I'm sure I didn't say that correctly. But anyway, if it's already been prescribed, thank you. That's a great step forward. However, the program is not yet adding people who need MOUD and did not already have it. So what else needs to be done to move forward? In my view, the jail must increase medical staffing levels so all health needs are met and the MOUD program can function properly. Moving staff to pods does not address the staffing level gap. There are 67 unfilled medical positions, according to the report that was on the table as I walked in, including mental health positions. And large number of unfilled positions have been constant for months and even years. 2 or 3 doctors cannot cover the jail, even with physician's assistants and nurse practitioners. And just being on call all the time, there still just isn't enough.
Ms. Younger, I've permitted you to go well in excess of your 3 minutes, so I'm sorry I have to cut you off, ma'am.
I'm sorry about that. I timed myself and I thought I could get through it.
Thank you very much for your comments. Thank you. It's much appreciated. We'll now hear from Alan Gunther. Mr. Gunther, if you could remember to please spell state your full name, spell your last name.
Sure.
Thank you.
Okay, my name is Alan Gunther, AlanGuenther.
Thank you, sir.
I'd like to talk tonight about reality. There is the jail officials' version of reality, and then there's actual reality. I think it's true from the health department reports that were cited that more than cinnamon has been found in the jail kitchen. And thanks to Bethany for pointing out some of the other things that have been found. But I've got health department reports here, all from this year. And from February of this year, there were 4 live rodents found in food storage areas. There were cockroaches in the kitchen. There was another cockroach by the floor drain of the kitchen. There were rodent droppings observed in a large white bin containing a powdered cheese product in the dry food storage warehouse. And rodent droppings and urine were observed on unused food trays stored in the kitchen. So this is from 2022. This is from February, all right? And then, so we go further on, and this is from June. Now, in June, there were mouse droppings observed in the alcoves and the corners and the shelves of the dry food storage room. There were rodent droppings. And then again, just from the recent report that we were told where there was no problem, in fact, there were the rodent droppings that Bethany pointed out. And again, over and over again, it says eliminate pests by approved methods. And these problems haven't gone on for weeks. They've gone on for months. They've gone on for years. You're right. And so no restaurant anywhere would ever be allowed to stay open with reports of rodent urine on their food serving trays. How can you permit these conditions to exist month after month after month? And would you allow your own loved ones to eat food prepared in such squalor? Why do you force the people in the jail to be treated in this way? Now look, there are other things that that we could talk about. There was the new medical program that was mentioned, which is wonderful. And if it's true, and if it's real, but the warden's own report from April said there were 53 medical staff openings. And just recently, you were working with a doctor who was barred from practicing medicine in 8 states. So yes, you've answered 3,156 sick calls, and that's very nice. But what happened to Mrs. Tipton's son, whose arm was broken while he was handcuffed, while he was naked? The jail never officially notified the family, and the mother has told us. And the bottom line here is there are 2 versions of reality: the jail version of reality and then actual reality. So what we need, what we're asking, because there are serious people here. There's Beth Shongard, Tim Stevens.
Mr. Gunther.
Yes, and I just want to say,
you've greatly exceeded your time.
all we're asking is to sit down and talk with you, to meet with you, so that you can hear our questions, we can hear your answers, we can have a conversation and exchange information back and forth, because these are good people who need to be heard.
All right.
And you need to answer these questions.
Thank you, Mr. Gunther. Tim Stevens.
Good afternoon, good evening, everybody. I'm heading out of here to a candidate event that we're helping to host tonight, so I'm leaving. Tim Stevens, Chairman of BPEP, the Black Political Empowerment Project. First of all, on a positive note, I'd like to thank the board for accepting our request that a committee be put together under your jurisdiction to examine the many issues that the Black Political Empowerment Project has brought to your attention, as well as APA and the other organizations and the folks who have testified. My hope is simply, with the letter that we sent, which was quite detailed before the last meeting, my hope is, as chairman of VPEP, that all of you, the staff and the Oversight Committee, examine that letter in great detail and follow through on the suggestions, many of which are supported by most, if not all, people in this room. I'm also asking the follow-up letter that we sent on behalf of Janelle Tipton regarding her son Aaron. I personally was quite upset by her testimony from this spot a month ago of what happened that Alan Gunther just referred to, and I hope that you will follow up on our letter to fully investigate that incident. It was quite troubling, and it needs to be resolved. My hope is that we can get a letter back from you in terms of what has happened, what you've done to, in fact, investigate that incident. The suggestion that Councilwoman Bethany has suggested of your own independent counselor seems like a very reasonable thing to do. It gives you a little more independence, and I think on behalf of the public, it may give the public a little more confidence into your decision-making, that you are listening to someone outside. Okay? So thank you very much. You see there's a turnout again. People have this on their hearts. And what Alan just suggested, I find absolutely sickening listening to it. I can't imagine sitting in your jail and having to deal with those conditions with regard to food. It should be an embarrassment to the board, embarrassment to the staff, embarrassment to the warden, and embarrassment to Allegheny County. Please fix it.
Thank you. We'll now have public comments from Pastor Dave Swanson.
My name is David Swanson. I'm the pastor of Pittsburgh Mennonite Church and the chair of the Spiritual Leaders Caucus for the Pennsylvania Interfaith Impact Network. I'm here to remind you all, the board especially, that incarcerated people are some of the most vulnerable people in our county. Their lives are literally dictated to them and for them in the jail. The jail system as a whole and the individuals within it have come to the point where the well-being of incarcerated people is sacrificed in favor of institutional posturing and bureaucratic stability that we have witnessed here in the report from Pitt and in reports from many folks who have testified. This fact was established by the Pitt study and evidenced in the failure of the jail personnel to really acknowledge the severity of the problems that exist on their watch at the last meeting and at this meeting. For people of faith, whom I represent, this is unacceptable. We believe the divine spirit is in each person and that each one should be treated with the recognition that their dignity and rights require, regardless of their status as incarcerated people. The Allegheny County Jail has failed egregiously to treat incarcerated people with sufficient respect and care. We appreciate some verbal acknowledgement of our demands, but words are not enough. We ask you, the Oversight Board, to formally and publicly adopt our demands which we have presented to you for improved services and treatment of incarcerated people. Those demands are as follows: that incarcerated people receive immediate medical attention at their request at no cost, and that the determination to provide care not be left to correctional staff. That incarcerated individuals be given the ability to add, delete, or modify emergency contact information at their request during all stages of incarceration and custody, and that this request be processed within 1 day of the request. Allegheny County Jail notify the emergency contact and the Jail Oversight Board with complete details around the incarcerated individual's medical emergency, hospitalization, or death within 2 hours of the event. That family members or listed emergency contact be allowed immediate access to hospitalized incarcerated individuals. Transparency into medical records of deceased incarcerated individuals for the board and for families. Practical resources be made available for detainees and incarcerated individuals at the jail in terms of their needs, medical needs, and bodily care. And community meeting with the JOB within 30 days if these demands are not carried out. So we want to meet with you as well. Thank you.
Thank you, sir. We now have public comments from Reverend Rod Tate.
Yes, my name is Reverend Rodriguez Tate, SRODRIQUES, Tate, T-A-T-E, and I am a member of PEN, that's Pennsylvania Interfaith Impact Network. And I'm also a member of Bidwell Presbyterian Church, and I am PEN's organizer for our colorful background for ex-incarcerated people. We're in partnership with Western Power, and we have issues, and I understand that I just have a couple minutes to speak, but so I'll get directly to the point. You know, we read about the Patients Care Program and the expanded facility. Why, and according, to this letter, this program has already been implemented inside the jail. And this letter looks good. By listening to all the things that they have stated, you would think that we were talking about a college. Because it seems like these things are so been taken care of already. That we don't have to worry about anything because these issues has been dealt with. But there's issues that we need to focus on that needs immediate attention, especially those inmates that are not receiving the meds as needed. Now, I have conversations with ex-incarcerated people. I have conversations with those who've just been released from the county jail, and their conversations does not match up with nothing that has been said here this evening. especially those that you have patients that are diabetics. See, I can understand this because I'm diabetic. It is different medications that is needed in order for me to survive. These medications are needed to save my life, but there have been issues when those that needs this type of medication to live don't receive it at the appropriate times. There are times in between lunch and dinner and lockup that a person that is diabetic needs to have some type of snack, some type of nourishment just to get them through the night. You have medications that is needed for those. Sometimes this medication is a 24-hour medication. Do they receive this 24-hour medication? Sometimes there are medications that you take with the 24-hour medication. You might need a medication 3 or 4 times throughout the day. Do they get this type of attention? Because you would think it would be if we was talking about a college, but we're talking about a jail system that is out of control. There are other issues that the inmates that have been hospitalized. We understand because we already know the answer as far as when an inmate has been hospitalized, that it's a security issue. But all we ask for is just a phone call. A phone call to the family and loved ones of the one that has been hospitalized. Just a call. We're not asking for any information. Thank you.
Thank you, Reverend Tate. I've been practicing this name to myself, but I'm sure I'm going to screw it up. Sharon Bonaliglia. I can't do it. I tried. I'm sorry. My apologies.
Repeat after me.
Bonavilia.
No, repeat after me.
Go ahead.
Bona.
You're cutting into your time now.
No, I'm not, because I have not yet introduced myself, and I believe you said before that my time doesn't start until after I have said and spelled my name.
Please.
And shame on you if you're not even willing to learn how to say it. Bona. Repeat after me. Bona volia. Bona volia. It means goodwill. My name is Sharon Bonavolia, SHARON, BONAVOG, silent, just scratch it out next time, LIA. I am a member of PIN. I am a member of City View Church, and I am a tax-paying resident of Allegheny County. And I am deeply disturbed that in this season that we begin of gratitude, I'm thankful that no one died at the Allegheny County Jail this month. And I am here to again cause us to remember the people who have. So I would ask you, if you're willing, to close your eyes and think of someone you miss dearly who has died. Someone that you would love to see at your Thanksgiving table. And then I would ask you to consider the families and the friends, the coworkers, and the people who dearly miss the following individuals: Richard Lenhart, Robert Blake, Cody Still, Daniel Pastoric, John Brady, Martin Buchek, Robert Harper, Vinkley Harris, Justin Brady, Paul Allen, Roger Millspaw, Paul Spisak, Gerald Thomas. Jerry Lee Ross, Jr. Victor Joseph Zelenek. Ronald Andrus. And Anthony Toloda.
Thank you. We'll now have public comments from Jody Lincoln.
Hi, Jody Lincoln, Jodilinccoln. Here as a member of the Pittsburgh Prison Book Project. And I'd like to start off by thanking Councilperson Bethany Hallam for her continued work around improving access to books and educational materials and resources to people at Allegheny County Jail. Last week, ACJ finally responded to a right-to-know request regarding books that had been rejected from Allegheny County Jail. I'd hoped that this had been provided to the board as well, but according to Controller Connor now, apparently it was not, despite multiple requests from this board to ACJ staff to receive that information over the past few months. This list only dates to July, as they were not keeping any records before then, and also, as we've heard earlier, appears to be incomplete. While the majority of rejections were due to the lack of receipt that we've heard a lot about and have spoken about, I'd like to touch on the books that were rejected for content restrictions. Wes O'Donnell's book, Rise, is an entrepreneurial book targeted at veterans. It was rejected for violent imagery/content. How to Start Business books are one of our most frequently requested genres and are extremely important to incarcerated people who are often discriminated against in the workplace. What violence could this book contain except references to military service? The Trials of Apollo, YA fantasy books by Rick Riordan, author of the extremely popular Percy Jackson series, were also rejected for violent content and imagery, along with other fantasy books and urban fiction titles. I'm confused about these rejections because nowhere in the policy are books with violent imagery and content listed as prohibited. That's policy 430, if anyone's interested. Restrictions per the policy include content that instructs on manufacturing of drugs or weapons and content that would be detrimental to the security of the jail. But just rejecting books because they include violence is not included in the existing policy and is a gross censorship. I'd love to hear from the warden or deputy warden, who are the only people per policy who should be rejecting books, the thought process and reasoning behind rejecting all of the titles rejected for content restrictions. Censorship is detrimental to the well-being of the people at ACJ and our communities. Why is ACJ going against written policy? Also, subcommittee on books, you guys know I'm always a resource. Love to keep talking to you. We'll chat. All right, thanks.
Thank you very much. Laura Perkins.
Hello, my name is Laura Perkins, Perkins, and I'm here to read a prepared statement on behalf of a community member who was unable to attend, but does not trust that Judge Housey will read their comments if they were submitted online. Hello, Oversight Board members. I've been attending Jail Oversight Board meeting for some time now, and I'm growing increasingly frustrated with the lack of transparency and accountability. I participated in the passing of the solitary confinement referendum, and I am invested in the implementation of the referendum as intended by the law and the will of the people. I'm concerned about the mental health tier system the jail uses as well. When you press the warden for answers, you are referred to the county's lawyer for clarity and assurance. Why does the Jail Oversight Board not have their own lawyer? Why are they relying on the lawyer who represents the warden's interests in order to assure them that he is behaving in a legal manner? Where's the legal pushback from the Jail Oversight Board? Who represents the interests of the public and the incarcerated individuals? To put it plainly and provide example, why would you turn to Donald Trump's lawyer for assurance that he is following the law? I would hope not. The county will protect itself, which includes protecting the warden and the jail from litigation. The current approach is nonsensical. Expecting legal justification for human rights abuses from the person paid to protect the interests of the county is a bad faith effort in providing transparency and accountability. We deserve actual advocates for incarcerated people. Secondly, as Laura Perkins now speaking, I want to make a request to the room at large that we avoid the word citizens. They're immigrants in the jail. They are residents. They pay taxes, and they participate in society, and they are not citizens, but they should be included when we refer to them. And also, as Laura Perkins, I would like to request that ACJ leadership, as you prepare future budgets and evaluate future private contract proposals, that you dedicate money and prioritize contracts that dedicate money to the translation of new written materials that are used by incarcerated individuals that use languages other than English. Please, please do that. Thank you.
Thank you. I believe this is Bonnie Fawn. Bonnie Fawn. She left? Okay. Nora Lohman. Forgive me if I mispronounce your name. Are they coming up here? Oh. She's not coming up here. Oh. Okay. I guess Nora Lohman is not present. Abhishek, that's as good. I'm not even going to try the last name. I don't want to mispronounce it. I apologize.
Hi, my name's Abhishek Vishwanathan, Viswanathan. Aaron Tipton's family has communicated that he has endured inhumane treatment at Allegheny County Jail. Aaron's case has been postponed various times since early 2020. He has been held for nearly 3 years without being offered an affordable bond or modification. In 2020, Aaron had a dispute with correctional officers, and despite him walking away, they followed him. A fight broke out. Since then, he's endured cell searches, been placed in solitary confinement due to refusing an unwarranted cavity search. He's been tased more than 5 times, assaulted, and had the largest bone in his arm, his humerus, broken. This caused Aaron to get an emergency surgery on his arm and had to get a rod placed in to reinforce stability. The COs have consistently said to him that this is payback for the incident in 2020. His arm being broken and the surgery occurred within the last week. The family wasn't notified of this until 3 days later from another inmate. This inhumane treatment has become all too common at ACJ. They've been in the news frequently for various deaths at the jail. Aaron has spoken with Internal Affairs regarding the misconduct of the COs. In addition, they want to make sure that the captain, sergeant, and COs are held accountable. Aaron has been seen in the infirmary and is now back in his cell. The community demands action be taken and the inhumane treatment of Aaron and other people in the jail stop. Whatever notions of justice you think you are dispensing is awful, dehumanizing, and rotten at its core. It's based on white supremacist notions of crime and punishment and is making our communities less safe and more inhuman.
Thank you very much. Marion Damick.
Okay. Okay. Yeah, it was, yeah. Okay. D-A-M-I-C-K. You know, damn it. I'm going to sit over. Well, oh, Right. I was going to talk about a lot of things, but I'm going to talk about my favorite rat. Rats, look, I'm telling you how to get rid of them because my house is older than this place because I was around with the judge when they built this, and I was here. Right, so you've got to be able, if I can get rid of rats in my house, you can get rid of rats here. It costs money. I'm sorry it's our money, but it's worth it, for God's sakes. You look at, and this is for Fritz. I call him Fritz, he lives in the neighborhood. Fitzgerald, for God's sakes, get some people to work, no traps. Traps aren't going to do it. To work in the basement, the grounds. The way to get rid of any of them is to stop them from coming in. There are openings you don't know about. There are a lot. Use them. Get rid of the rat. And I mean, if a person like I can hire somebody to do it, you can hire somebody to do it. And for goodness sakes, people then won't die from what they're eating. I had a lot of, other things, mostly health care. Good news. No suicides, no suicide attempts. The last 2 months, whoopee. That is a whoopee. And that's the first time it's happened for a long time. So, look, there is some hope in the world here. What's in it? The other thing is mental health. Well, one, of course, you don't have the doctors, you don't have the psychiatrists, you don't even have anybody from Allegheny General Health here. And that's the medical director is zero. That's a big deal. Get somebody to run this place. Also, you've got to, with the health care, please, besides medical people, all right, mental health. If you look at the record, how many have been committed to the hospital, which is actually one of the worst, but whatever, to the hospital. Then you look at the number, much less who get in. All those other people are sitting, waiting, mental health problems, and they aren't getting in. Because what? Is there no space? There's probably. Also, it's not that, well, forget how good it is or how bad. You've got to get help for them, and you're not doing it. And I think Fitzgerald can talk to a lot of people, and I'm talking about talking to the state. To get some money, it's a state, I'll be down. It's a state institution. Get it fixed so it takes the people who need the work, the help. Thank you.
Thank you.
And I'll have a good whatever's coming up.
Thank you very much. Miss Tanisha Long.
A little taller. Okay. My name for the record is Tanisha Long. I would first like to start out by acknowledging the fact that public comments were pushed so far down into the agenda that there are only 5 board members remaining. 4 board members and the ghost of Rich Fitzgerald. So that's not okay. We don't need the warden to give us answers to questions we haven't asked yet. That's not respectful. It's not precedent. It hasn't been done in the past 2 years. It's not what Judge Clark used to do. It's disrespectful. Prioritize the public. You're here to answer our questions. I don't need to hear from this man first. I don't need to be lied to. You can do that later on in the meeting. We deserve our time to be heard by as many board members as possible without interruption. Next, I would like to read something in support of Gerald Thomas. I'm here to remind the Jail Oversight Board that this month, Gerald Thomas should have turned 27 years old. His mother, Wanda Saunders, could not be with us today, and we stand in solidarity with her in grief as she mourns her son. Due to the jail's negligence, poor medical care, and lack of concern for our incarcerated family members, Gerald is not here with us to celebrate his 27th birthday. He's not here with us to celebrate his daughter's first birthday. He's not here with us to meet his new niece. Gerald is one of many people who have suffered at the hands of Warden Harper, the Allegheny County Jail, and, by proxy, the board. If the jail continues to operate the way it is, he will not be the last. The jail continues to commit human rights violations and pretends that it's for safety reasons. Safety for who? I do not feel safe when my loved ones are in danger. I do not feel safe when the warden is killing people unchecked. The jail invents reasons to harm people. What is the legal, scientific, and medical reason for the mental health tiers? What is the dietary reason for feeding people food with feces, not cinnamon? Why are people going into the jail healthy and leaving in body bags? On November 25th, I want you to remember that it is Gerald's birthday, and he is not here with us because we failed to keep him safe and the warden in check. Remember that Juana Saunders still has not received answers about the death of her son. Be thankful that you are not on this side of her pain while you continue to allow people to suffer. Thank you.
Thank you, Ms. Long. Allison Haley Lewis.
Thank you for your time. My name is Allison Haley Lewis, HALEY-LEWIS.
Thank you.
I'm here on behalf of the Corrections Collective, which is a community-based advocacy group representing over 20 community organizations. I believe this first point was addressed, but I will read it anyway in case I misunderstood. In PA County jails, people with mental illness are routinely met with pepper spray and stun guns. This article, published on October 15th, speaks to the lack of adequate mental health care and crisis intervention in jails throughout the state. In contrast, Allegheny County is reputed for having some of the best mental health and crisis intervention services available. And while this reputation does not yet extend to our jail, it could. We ask that the Jail Oversight Board request county executives to redistribute RFP 8611, which seeks proposals for crisis intervention training at the jail, and circulate it among your community mental health providers that are known for providing regular and effective crisis intervention. Secondly, you know there are ample concerns regarding transparency at the Allegheny County Jail, and we believe the liaison position is a great opportunity to abate those concerns. So for that, we are asking the county executive to issue a public statement stating that the liaison will be permitted to obtain any information the Jail Oversight Board deems necessary. The jail has stated its intention to reduce or eliminate paper use, which increases the need and uses for tablets, including requesting medical care and filing grievances for staff misconduct. We request that the Jail Oversight Board ensure every inmate has access to a tablet for that reason, and that no individuals are restricted. And finally, regarding the redesign or the reimagining of the jail, the plan outlines months of community engagement, and we would like to advocate that an individual who has experienced being incarcerated at the jail be present at every planning meeting. So thank you for your time and all the work that you guys are doing.
Thank you very much. I apologize in advance. I can't tell if this is Nadine or Nidra. I'm sorry, but it looks like Nidra Narner, perhaps? Nadia, I'm sorry, I couldn't read it.
Yep, Nadia Narnor, Nadia-Narnor. So I'm first here to talk about some thoughts from Joe Abercrombie. He was a British fantasy author whose book, The Wisdom of Crowds, was rejected based on violent imagery / content. While notified that his book was censored at the Allegheny County Jail, Mr. Abercrombie tweeted, "I'm strongly against censorship. Seems to me people dealing with serious issues need books that tackle those issues if they're going to make some positive change in their lives." And given that someone like Rick Riordan, whose books are widely read and loved by kids and far from the gritty end of the spectrum, is also turned away, it feels like it can't be a terribly well-considered or consistent policy. The jail's failed book policy has not only created a culture of censorship at ACJ, where people are actively discouraged from getting books, but it's caused financial harm to the family members and friends of incarcerated people at the jail. An analysis of the rejected books list released by the jail in the response to the Right to Know request found that the cost of purchasing and shipping all those books was over $2,100. The jail staff admitted not notifying senders or intended recipients of rejections, and it's very clear whether they're even getting back to Barnes & Nobles, etc. We have multiple conversations with folks trying to send books, but they're not even getting refunded. Barnes & Nobles has an approved vendor, but the jail is not accepting some of the books. The financial exploitation of incarcerated people and their families is grossly monopolized, and this communication is made worse with visitation restrictions, overpriced commissary that goes against the county's own contract, and people trying to get books to their loved ones while they're in solitary. The JOB should be horrified at this gross exploitation, censorship, and the jail's continued failure to have effective procedures in place. There are shipping addresses on the boxes, so I hope you use them when you see them. I also want to mention that whatever is quote-unquote typical in jails and prisons doesn't mean it's ethical or right. I don't care if there's less staff at another prison. It's not okay for my tax dollars to be going to this and seeing what is happening. And I will annoy you until you care. All of you. I will look into your eyes and annoy you until you care, because I'm not okay with my money being spent like this. If I don't do my jobs, there are repercussions. If CEOs don't do their jobs, if you don't do your jobs, why is it that I get a repercussion for not doing my job, but you don't? How do you wake up every day and say the same things to your community? With audacity, too. That's the thing. There's so much audacity that you do not deserve to give us. It's ridiculous, and I will stand here until you care.
Sorry about that. Maria Ryabova, perhaps?
Hello, my name is Maria Ryabova, R-Y-A-B-O-V-A, and I'm here to speak about the deplorable way the Allegheny County Jail handles mental health issues in the jail and the poor treatment of incarcerated people. The jail currently grades the mental health and wellness of incarcerated people and assigns them a tier. This tier system has not been transparently explained, and I'm unable to find any scientific or medical research that supports such a system. It is not a medically industry standard. From what I can see, it is another way the jail punishes people needing help or people they deem difficult. We have seen this from the jail for decades, chaining pregnant women to tables because of a mental health issue, using the restraint chair, using solitary confinement as punishment for mental health episodes, cages around the mental health pod, and so on. These tiers are punitive. They only serve the purpose of causing further harm and are used to encourage neurodivergent and mentally unwell people to behave in ways they are not always able to. People with certain mental health tier designations are not allowed tables, paper books, socialization, and recreational time. Tell me, what does taking everything away from a mentally unwell person do to their mental health? It isolates them, deteriorates them, depresses them, and harms them. The jail is creating a cruel and unjust situation and refuses to provide medically backed reasoning that justifies their inhumane methods. I call on the Jail Oversight Board to force the jail to provide medical and scientific reasoning for these practices to end them altogether. Thank you.
Thank you. Kim Williams?
She had to go.
She had to go? All right. That was the last public comment. I received a public comment from...
Pause. May I speak for Kim Williams? Did she have to leave?
You didn't sign up, but come on.
He's speaking for Bonnie Fan.
No one's, so this is the problem. No, they didn't sign up.
Also, there are no rules that say that you have to sign up by the start of the meeting in order to speak. No other body that I've ever participated in requires that, so I don't see any problem with allowing either of them.
I appreciate you not seeing a problem with it, but there is a problem with it because there's a rule that we have.
Where is that rule written? Can you show me?
So,
Can you show me where that rule is written, Judge Halsey? Please don't make wild accusations in a public setting. Can you show me where that rule is written?
You may have your 3 minutes.
Judge Halsey, please. Can you show me where that rule's written after the meeting, maybe?
I'm speaking on behalf of Kim Williams from APA, and she was sent this letter from who I'm assuming is an inmate currently in the Allegheny County Jail who recently went through the intake process. So I'm reading this sort of verbatim, so forgive me if parts of it don't make sense. It says, Anthony Townsend's experience in the evil ACJ. Starting from the beginning with me going into intake. When I first got in the door, not even fully in the jail, the guards searched me, and then the jail guards took my shoes away from me and gave me orange sandals and made me go home with them because they let someone steal my shoes. I never got them back till this day. They were nice shoes, and it's on their camera when I came in with the shoes on my feet. Next, in the jail processing, I was completely neglected. No guard in the processing section would help me with toilet paper for the toilet. They didn't help me when I asked for at least a blanket to cover up with because it's really cold in there, and all I had on was thin clothing, no shoes, and was sitting in a room full of germ-infested people that, like me, haven't had a shower since being arrested. I asked for a shower every day and was denied that as well. They gave me nowhere to sleep, as well as others in that situation. I was down there without any meals. They only gave me bread, a thin slice of some kind of meat, and an elementary school carton of milk that was not even consumable and made everyone throw up. I was down there for 3 days straight, no mat or a shower for 3 days. Mind you, I'm still around others as well with built-up clogged pores of germs for 3 days like me and really low immune systems. They gave me no food for those 3 days and kept me in a very small room filthy with people's blood, urine, and human feces for those days. Nobody even cleans them, just a person that comes in and sweeps and mops the floor. Then, after those 3 days of torture, because that's exactly what I'm saying it is when humans are being treated like they are not humans, it's torture. Going through this traumatic treatment in there, into the system proves them guilty, keywords, into this system proves them guilty. I and others received very bad punishment, and a lot of us were still innocent being detained, but still received the torture for the jail, resulting in my back being messed up and also my life that I worked. This is what he sent. Thank you.
Thank you. Thank you very much. With that being said, I was going to read a public comment from Mr. Kostinowicz. He's tending to some medical issues involving his family, so I wanted him to know that our concerns and prayers are with him and his family. Mr. Kostinowicz wrote, considering the conflict between the Jail Oversight Board and the Warden of the Allegheny County Jail and his lack of cooperation in providing information and records to the board, how is the board's proposed liaison, who will be investigating the jail on behalf of the board, going to obtain access to records and talk with the staff of the jail? I propose the following 4 remedies to alter this atmosphere of conflict. These can help provide the liaison with the opportunity to obtain authentic information from the jail staff, and records. 1, the board will send a statement to all jail staff concerning the board's responsibilities of oversight and the need for their liaison to obtain accurate and complete information from the jail staff and to obtain access to its records. 2, the liaison will receive an orientation from the rank and file staff regarding the many operations of the jail, such as intake, providing medical and mental health services, etc. 3, the warden will announce to his staff, the board, and the public that his staff is to be completely transparent with the liaison and answer questions in a complete and accurate manner. 4, the county executive will provide a message to all jail staff, the board, and the public that the jail staff is to be completely transparent with the liaison and report any evidence of reprisal to him for further action to be taken. People incarcerated, their families, and the public deserve nothing short of these 4 remedies being implemented. So that was from Mr. Kostinowicz. So with that being said, we move on to old business. As you all saw, Judge Lazara had to leave, but she did indicate, along with our County Controller O'Connor, that there are 42 applications for the liaison position, and there was a motion today to close the application process. So I guess the goal now is to go through those applications, review them with the goal towards getting down to a limited number of people who are most qualified for a subsequent interview. So with that being said, update on the compensation for work performed by incarcerated individuals. Ms. Hallam.
Yeah, I don't have any update for this month. I think I gave the biggest update last month after talking to the folks at the PADOC. I have somebody that I need to connect with in the controller's office to look at the categorizations for a new employee to pay the incarcerated individuals. And I have an email out to Nova Time to see if keeping track of the time is something that they'd be interested in doing. But that's all I got.
So with that being said, ACJ and alternative housing population statistics. So I'm going to read you the statistics that Judge Lazare received from pretrial services, court administration, and adult probation. The status of the jail population as of 4:30 p.m. on October 31st, 2022 was as follows. 1,343 people were in the Allegheny County Jail. 152 people were in alternative housing facilities, excluding any people with holds by the federal government. Note that people can be held in the jail for multiple reasons, such as probation and parole detainers, other county holds, or sentences. 6%, which would be the equivalent of 85 people in the jail itself, are serving a county sentence as the result of a new conviction. 29%, 44 of 152 people in alternative housing are serving a county sentence. 22%, which represents 292 of people in the jail itself, had a hold from an external jurisdiction, including other counties or the state. Only one of the 152 individuals in alternative housing has a hold from another jurisdiction. 39%, which represents 529 of the people in the jail itself, were detained by Allegheny County adult probation. These individuals were detained for violating probation on a crime for which they had previously been convicted. Of those, 88%, which represents 466, were of moderate or high risk to reoffend based on their probation proxy risk score. The remainder were being held for a variety of reasons, including violent felonies, awaiting mental health commitments or service plans, and other reasons related to their own safety or the safety of the community. 22%, which represents 33 of the 152 people in alternative housing, were detained by Allegheny County adult probation. 85%, which would be 28 of the 33 of those detained in alternative housing, were of moderate or high risk based on their proxy score. 26%, which is 354 of the people in the jail itself, were held pretrial only, meaning they had no other reason such as external holds or detainers keeping them in the jail. Of these people, just over 1% screened as low risk for reoffense based on the Allegheny County locally validated pretrial risk instrument, without consideration of the seriousness of the current offense. 19%, 29 of the 152 people in alternative housing, were held pretrial only. None of those people screened as low risk for reoffense based on Allegheny County's locally validated pretrial instrument. 79 individuals, approximately 6% of the jail population, are currently being held in the Allegheny County Jail pretrial only on monetary bonds. Of these individuals, only 6 screened as low risk for new criminal activity, and all these individuals were facing violent charges. Only one of 152 people in alternative housing is held pretrial only on monetary bonds. This person screened low risk for new criminal activity, but was facing a violent charge. All pretrial monetary bond cases are reviewed for possible bail modification. The Allegheny County jail population, I'm sorry, this is old. Forgive me, that's a mistake. So
Just housing. Just before, I know the sheriff wants to make his motion. We were told last meeting that those would be sent to us as opposed to just read at the meetings. Can you send that to us?
I don't have it, so I can ask Judge Lazare. She just left this with me.
I mean, then can I just have it to take a picture of it? Thanks.
Left that. So with that being said,
Judge Housing, one other thing.
Yes.
I would just ask that we as a board look to revisit doing our executive sessions, whether they be every other month or some kind of regular time, to have some conversations and also some interviews on some of the topics that come up during these meetings.
fair enough. With that being said, does anyone, are we doing a motion or are we going to do the jail inspections? I don't know if you want to discuss your.
Oh, yeah, well, that's.
Well, and
Want to do yours first, and I'll pull up mine?
you can go first. And then the thing is that in the future, consistent with our obligations as board members, those visits need to be detailed on the website.
Okay.
So to that end, I'd ask that you put your notes on the website.
I'll put my notes on the website. You still want me to talk about it?
I
Or
don't
you guys
know.
want to go first while I pull mine up?
No, you can go first.
Okay, you're just gonna sit here and wait? Okay. What date was that?
I don't remember.
I mean, Yins were there when I got there, so what date was that? Thank you.
I'm gonna pass that down there.
Okay, I'm ready. Okay, so I am so sorry this is so late. I'm just like overwhelmed and swamped and haven't wrote this up in my official report yet. But anyway, so on September 23rd, I did a surprise visit to the ACJ. I got there a little after noon. I went there actually in response to hearing about Anthony Tallada losing his life in the jail, and I wanted to know what happened and talk to the people who were with him up until it happened. So when I first got there, when I get there, I have to enter through the employee entrance to go through the metal detectors and things. An officer at the door asked if I was here with the other board members, to my shock. So of course I was like, what other board members? Like it was some official visit that I was just being excluded from. But anyways, I said, no, I'm here by myself. And so I have to stand there and I have to wait for an employee for someone to come and escort me around the jail, as is per usual. So Warden Harper came down in the elevator, and I informed him that I would be more comfortable doing my visit with someone else escorting me. So he took me upstairs in the elevator and called some other folks to take me around. When we were in the hallway, I, to my surprise, saw Mr. Pilarski and Judge Housey in the hallway, who were apparently doing a visit at the same time. I told them that I first wanted to go to intake. Not them. They weren't with me. We did it separately. But, I told my guide that I wanted to go to intake. I took the elevator down to intake. The hallway entryway when you're walking in, so there's the end of intake where there's the bigger cells and where there's the phones and the seats and the vending machines and stuff. But the hallway, I noticed, had the cells lining that hallway leading up to that had people in it, which was just more than I was normally used to seeing when I was coming down to intake. There wasn't a ton of people in the main area, about 15 to 25 people. So I did what I usually did. I would walk around to them and ask them, what can I do for you? What do you need? There was a young man who was talking on the phone and he couldn't communicate in English. And so, I used my undergrad Spanish minor to try to help him and just figure out, because he was petrified. It was a young man and he was in a jail where no one was speaking the language that he knew. And so, I used my kind of broken Spanish to find out what was going on, and, later reached out to Casa San Jose and connected his family with them and did all that. Largely uneventful trip to intake this time. Next, I went to the kitchen, which that was wild. That was eventful. So when I walk in, now I've been there enough time where people know who I am, and so they crowded around me to talk to me. They all had things they wanted to tell me about. A couple of the incarcerated individuals who were working in the kitchen, and now remember, there's a decent amount of people who are working in the kitchen at any given time. So fortunately, I got to talk to all of them, and they actually, I will never forget, one of the guys actually said to me, oh, I heard they've been telling you that we don't have rats and roaches. And so one guy comes over, he was like, hold on a second. He walks over to somewhere that I couldn't see, and he came back with a napkin in his hand, and when he opened it up, just roaches came out of his hand. He had literally went and picked up live roaches. I, again, didn't see where they came from, but these were roaches. And when he opened his hand, they jumped out like a swimming pool party or something. I have no idea. The next person comes up, he had walked away, he came up, and then he comes over and he's holding a mouse by the tail, and it's I thought it was dead, and it started moving, a live mouse that they just were on command within seconds able to go and collect these live rodents. And yeah, I said, I've heard that, and they said, well, do you want to see it? So, oh, that's about the mouse. That's about, yeah, so I thought it was dead. The leg started moving. So then a few of the incarcerated individuals who seemed that they were kind of like maybe the managers of the kitchen duty, they gave me a little tour of the kitchen area from them. And many of the corners in this kitchen area, which is big, right? They're preparing meals, like thousands of meals a day, right? And each of the corners has this like black, it's like this like smoke detector sized thing, and they say this is where they trap all the rodents. And a couple, like somebody kicked it for me to show me how heavy it was because it was so full of rodents. And that all of them were like that. We went around to the corners and they showed me all of them. Someone tried to open it up and I was like, no thanks, don't need to see that. I can see the weight. We went to dry storage. It was actually like, that was the one place that I could say wasn't gross. I actually have that it was clean when I went to dry storage. Went to the freezer, that was fine. A big concern that I had when I was in the kitchen area was that the ceiling, now the rest of the jail, for the first time since the last time I visited about a month or two before, there was a lot, like new paint in a lot of the jail. It actually looked kind of nice. They had a fresh paint job. The labels above each elevator and pod were painted differently. It looked kind of good, and so it stood out even more than normal that the kitchen ceiling hadn't been touched. It was something that the incarcerated individuals say was mold. I am not an expert, but it sure is something black, and it was like splotchy, like somebody took one of those like bingo dabbers and like put them all over the ceiling in huge areas. And it smelled horribly. Next, we went to the tray cleaning assembly line where they showed me a dead rat that was actually right on the ground. This was not a mouse. This was a rat in between the machines in the line. It's kind of like a horseshoe shape. And in between that, they pointed out on the ground where there was a dead rat. Next, the person who was responsible for the menu showed me the menu for a single week in the jail. And you all can see these. They're mostly posted online. And pointed out all of the things on the menu that they've never, ever, ever had. So this is what they're publicly putting out as a menu, and these are the items that we've never had. These are the ones we're out of now. Certain items that they've never had that were on the menu: hard-boiled eggs, cake with frosting. Next thing was they told me there was a weird stench, and again, my smell's like not really my forte, but something smelled funky. The person who showed it to me in the kitchen reported getting sick from the smell, not that long before I was there, and we were unclear what the source was, but it was near these big massive pots where they like, cauldrons, like stir up all the food. So then they gave me, so again, this was around noonish that I got there. So I saw the morning crew, and I was very interested, especially since we're looking into a way to pay incarcerated individuals. I was especially interested in like, what's your schedule look like? How many hours do you work a day? What's your work week look like? So the morning crew informed me that they are awake, and remember, this is all for no pay, $0 an hour. They are awakened at 4 a.m. They come down to the kitchen around 4:15. They're not allowed to give excuses to not go to work. The afternoon crew was like starting to come in whenever I was there. They around 1:30, and they stayed till about 7 or 8. When I asked as we were leaving the kitchen, the person who was escorting me, why the rest of the jail was freshly painted, but the kitchen still looked like that, and they said that it was hard to do this stuff in the kitchen because it's always being used. But again, from 8 p.m. to 4 a.m., there's nobody there. So next, I went to 5F because that is where Anthony Tallada died, and that was only 2 days before I was at the jail, so I very much wanted to catch the people who had seen it while it was still fresh on my mind. I talked to multiple, so now what I'm about to say next is independently verified by multiple people that I talked to on the pod. Lots of people were still shaken up from having witnessed this incident happening. And luckily, one of the individuals actually was so concerned that he thought something bad was going to happen that as this process was playing out, he actually took notes and was able to show me his notes of sadly, like a timeline of how Mr. Tallada died. So now this next section is me repeating what was communicated to me about Mr. Tallada dying. So two of the men that I talked to said that they were sitting with Mr. Tallada before his medical emergency. They said it was around 7:30 p.m. and they were sitting with him because he had severe mental illness, and they were trying to help him figure out his tablet. He couldn't figure out how to use the tablet. And so they're sitting there in the commons area, and then it's getting close to 8 p.m., which is when folks have to lock in for the evening. So as the corrections officer is announcing the lock-in, Mr. Tallada is clutching his chest and saying his chest hurt, and was having a hard time like kind of explaining what exactly was wrong. He said he wasn't able to, they said he wasn't really able to communicate what he was feeling, but they said that at the time he did have a wound on his foot and that they were concerned, did that have anything to do with it? They said that a short while before this, he was in the commons area and he was fine, but now he was like stuck in the chair and couldn't get up physically. The CO on the pod, they say, was telling everyone to lock down. Mr. Tallada couldn't move and was just sitting there. So one of the two men that was sitting with him said that they went in while one of them waited for Tallada, and then eventually the second man went in as well, while Mr. Tallada was still sitting there clutching his chest. As the corrections officer on duty was yelling at Mr. Tallada to go into his cell, they said that he still couldn't move, so the corrections officer called what they called SWAT. They said the doctor, which we now know, Izzy, came up with that SWAT team, which I think we know as the CRU. They claim that the officers, and now remember, this is a mental health pod, and they claim that the officers that came up started making fun of him, calling him the R word, and saying that that's why he's doing this. There's nothing actually wrong with him. They said then the SWAT officers dragged Mr. Tallada into his cell. They said that after the SWAT team left, that the nurse came around for nightly meds, and they said that they took note that whenever the nurse got to Mr. Tallada's cell, she apparently said that she heard he was being a pain in the butt tonight, and that's why he wasn't getting his medications. One of his neighbors then, after hearing those comments, immediately, that he had been taking notes throughout the process, he said he immediately submitted a grievance to Internal Affairs on his tablet detailing what he had just witnessed. They said that shortly after that, when the corrections officer was doing rounds, he noticed something was wrong with Mr. Tallada and called for a medical emergency. And they said that that was then when the medical team came up. And they said that the medical team pulled Mr. Tallada, who was on his mattress in his cell, out of the cell into the pod commons area where everyone could now see him. They said he was not moving, but you could tell he was breathing really quickly and really heavily, and that the medical team then called the paramedics. The medical team, they say, did not do any CPR or other life-saving measures, but were telling him, calm your breathing, which, you know, apparently he could not. And that's when the paramedics came and took him out. Again, you know, I want to stress that a lot because this was really the point of my visit this time, was to find out what happened to Mr. Tallada, because I think it's very clear to everyone who's in this room today, we're not getting them in this setting ever. Next, I went to 5MC, which is where the children are. It's kind of hard on that pod to get some, like, you know, one-on-one time with the kids who are in there, because the pod's a lot smaller. As was mentioned earlier when we were talking about the basketball hoop, it's harder to kind of get a distance and like have some real one-on-one with them because it's a smaller area. And so like my escorts and the CO on the pod are right there most of the time. So the kids usually just like laugh at me like, you know, I'm not going to talk to you while they're sitting here with you. Can't blame them one single bit. So, you know, one of the recommendations that I pulled out of that is that it would be really nice if there was somewhere that I could privately go and talk to people who are incarcerated. Maybe you guys experienced that on your visit, that it would be nice if you had more privacy to be able to talk to incarcerated individuals where no one can hear you. And they had two requests. You know, I always say when I go and see the kids in the jail, it's the saddest part of the visit because, you know, so many other people in the jail, when you talk to them, what can I do for you? It's like, can you look at my case? Can you get me a lawyer? Can you get my detainer lifted? Can you get me out? The kids just want the most basic things. Last time I went, they wanted their headphones fixed and they wanted hot water so they could make their ramen. And then, this time it was that they either wanted to be moved to a different pod or they wanted a basketball hoop installed, which that happened. And I'm so happy that happened. I can't wait to go visit them and hear how it's going. So next I went to pod 3B. This was my last pod that I went to, and I talked to a transplant recipient who said that they were supposed to be getting blood work done every 2 weeks as a result of their transplant, but they have never once gotten blood work for that, even though they had been there for months. They also said that they were supposed to take a specific dosage and a variety of medications for this transplant every day, and that he, quote, only gets some meds sometimes. He said that when he was first incarcerated for a couple months, he didn't get any of his meds, and his loved one tried to bring down his meds, but the jail refused. Next, I talked to somebody who had a broken tablet, and they charged him $350 for it. He was actually, really concerned about this because he was completely cut off from using a tablet. He actually had to log onto his account on someone else's tablet because he didn't have a tablet, which I know you're going to keep hearing that no one doesn't have a tablet, but I promise you they do not. There are people who do not. And also, the tablets they get are these crappy little Android joints, and there's no way those things cost $350. But I did write down here the operating system and the type of tablet so that I could look into how much do they really cost and why are we charging them $350 for a broken one. Another person had this really, very intricate list of commissary items, and they had been keeping track of how much they're paying for commissary for various items and what items are available and when items are removed. And they were complaining to me specifically that there was no Dial soap anywhere, that the only soap that they could purchase was Dove, and it cost $4.09 for a bar of soap. So those were my biggest things. The only other thing that I think I missed that I wanted to add is the man who claimed that he sent the grievance to Internal Affairs after seeing Mr. Talata's medical emergency actually showed me that grievance. He showed me that it was cleared, basically. It wasn't just submitted, but it was also cleared as if we dealt with this, we handled this. So anyways, these are just, the notes that I took from the people that I talked to. I was less there to look in corners and cracks and more to talk to people and see what they've been experiencing. So I'll be going back soon, so see yous there. Thank you, Judge.
Mr. Pilarski.
Yes, we were also there on 23rd, and I'll try to paraphrase in the interest of time since my report was posted online, but myself and Judge Housie conducted a surprise inspection. We walked down to the jail and visited the kitchen, the intake area, went up to the medical pod, the juvenile pod. We asked to visit a female pod to see, but it was shower time at the female pod, so we didn't spend much time there. We were only there 2 or 3 minutes and left the female pod. But like I said, in the interest of time, I just want to paraphrase just kind of where we went. And I noticed in Mr. Kostenowicz's response, that we didn't put that it was a surprise inspection. My apologies, I thought that was a given since that's part of the statute. I don't know why I would think we wouldn't conduct a surprise inspection, and that I had said that Captain Frank was there, but Captain Frank was who escorted us. Captain Frank was always stood back while we talked to any of the inmates or the workers, or incarcerated individuals or the workers, and we asked her questions as we went from the next area if we had any follow-up questions. So thank you.
Can I add something real quick? Because you just made me think of a good point. I do want to say that the people who took me around were respectful and stepped back and let me talk to folks. And I do appreciate that because I'm sure you can imagine. The only pod that it was really hard on was the pod with the kids. But every other one, the people who escorted me were very respectful and gave me my space with them.
I think a lot of the kids were still in school when we were there.
Oh, see, mine was that they were hanging out. They weren't in their cells, so they were hanging out in the commons area, and it's just small. But yeah, sorry for interrupting. interrupting.
They were respectful, and they did stay back. I mean, I don't think I used the word she was present, but we did have follow-up questions. If we had any, we asked any of the officers that we ran into, or the individuals, or Captain Frank, as she escorted us from one area to the next.
I'll just briefly will say that I went there on the same day, unannounced, went through the main entrance. We were escorted by Captain Frank. I think the first place we went to was the kitchen. The incarcerated individuals were running over to us with a list of complaints. Some said the food was not very good. Others said the food was better than Westmoreland County's jail. One gentleman said he had been to all the jails in the surrounding area, and Allegheny County had the best food. A lot of the incarcerated individuals in the intake department, as well as in the kitchen, indicated that they felt that they were treated with respect, and people did their best to make sure that they succeeded and they had the things that they needed. Some indicated that things were a bit trying and difficult, to say the least, during the pandemic, but they felt that people were treated with respect. I must say that two things I must say. We went to the security center, for lack of a better word, and what I learned is that jail is a 1 million square foot facility, but every square inch of that jail is under surveillance. There's a camera for every single thing that occurs in that jail, whether it's a phone call, whether it's a FaceTime call on a tablet, or whether it's just an interaction on a pod. Everything is recorded. So I thought that was noteworthy. And it was also noteworthy that the jail has the ability to go back in time, months back in time, and review that footage for any incidents. So I would say that a lot of these things that are allegedly occurring would be captured by video if they truly did occur. The other thing that was noteworthy for me is when we went to the kitchen, a number of incarcerated individuals walked up to us and said that they showed us the mouse and rat stations where the bait is contained, and they quickly said, there are always rats and there's always mice in those stations, and we can show you. So of course we said, well, show us, take us over there and show us. And they opened, I believe, 2 of the stations, and there were no mice and no rats in there. And the guy turned around and he said, well, it's usually not like that. I said, okay. He said, well, we have roaches too, but I have to admit, we haven't had roaches in a long time because they do pest remediation twice a week. And he said, too, that they take extra care to clean the kitchen and keep it clean. They can't go back to their pods without cleaning the kitchen because they eat there, too, so they take pride in cleaning the kitchen. Another gentleman ran over and said that he wanted to show me where the black mold was on the floor. So I said, okay, show me where the mold is. So I went over and I looked at the area where he was pointing to, and it was nothing more than old glue on the floor where the towel had come off, linoleum towel had come off the floor. And I looked at him and I said, that's mold? He said, nah, probably not. And so all I can tell you is the truth. Some will say in court there are 2 versions of events, and the truth usually lies in the middle. But a lot of these things can be verified with the surveillance cameras, and I didn't see any rodents. People were looking for rodents. They were opening up the stations to show us rodents. I didn't see any rodents. I didn't see any mice. I was in the kitchen. It was my first stop, and I was there for an extended period of time. Whatever Ms. Hallam saw, I was not there with Ms. Hallam. I can't attest to that. I can only tell you about my experience, and I must say, that was not my experience. Seeing any dead rodents, seeing roaches, that was not my experience. We went upstairs. We also did the intake and just saw that whole process for how people are brought into the facility, the checks and the process for bringing them in, the process for giving them the opportunity to post bail or to get out of jail versus being admitted and going upstairs. We went through that process. We spoke with a number of people who worked in those departments, correctional officers, as well as people who are actually in the county jail. We went up to the pod with the females. We went to the pod with the juveniles. We went to I believe it was the 5th floor, the medical pod. And the thing that struck me on that pod was it literally looked like a small hospital. And I spoke with the medical staff that were there, and they talked about how, they had people in the ACJ that are there for terminal illnesses. There there. Some were there for terminal cancer, the different types of treatment that they're receiving, the type of treatment that they can administer, and they just gave us a breakdown of the things that they can do and the things they can't do in terms of addressing some of the medical issues that are prevalent in the jail. We also went to the young ladies' pod. They were showering. We went, where did we go after? We went somewhere else after the 5th floor, but we went to a number of pods. And myself, having been an attorney, I've been in the county jail on countless occasions. I've never been able to go to those spaces. I usually was just there for a visit. So I was able to get a view of other areas. And I'll say it's a 1 million square foot facility. To suggest that there would never be a mouse or maybe even a rat there, I'm not prepared to say that to you. I can tell you, based on what the inmates and the staff told me, forgive me, the incarcerated individuals and the staff told me, that on at least twice a week there's pest remediation there, and when they went to go look to find rodents to show us, they were unable to do so. I'm not saying there's never been a rodent there. I'm saying at that time when we were there were no rodents. I can say, generally speaking, the facility was clean. I was also struck by the number of correctional officers that said to me they loved their jobs. They felt that it was a decent wage for the work that they did. They felt good about the work. They felt good at the end of the day. The one gentleman even said that he was able to provide for his family and provide them a decent quality of life. And he said, a couple officers said if they had it to do all over again, they would still work in the jail because they love it there and they feel that it's an honest living. They said the biggest problem to retaining employees has been the abuse of mandated overtime. That's been the biggest issue, has been mandated overtime. So that causes problems because a lot of a lot of employees are forced to do overtime when they don't anticipate that during their day. So they said that was one of the biggest impediment to retaining staff. But I didn't have it. I mean, there are people who say, yeah, there are things about the jail that they would love to change, but overall, the people that I spoke with on each pod, they said it was a pretty cool place to work. It had its pros and cons, but overall, they were happy that they came there and they felt that they were making a difference and being impactful. The other thing that happened was there was a young man in the medical pod. He said that he felt that the one issue that he had was that he didn't feel that information trickled down far enough. He felt that information was kind of discussed on a what would that be, a micro level, but it wasn't macro. It didn't filter down to the staff who had to implement some of these edicts or whatever. So he felt that there should be more information that should be exchanged. But overall, the people that I spoke with, they all said that they enjoyed their job. There were pros and cons. There were good days and bad days, but overall, they enjoyed working there. So, and again, my summary is written on is posted on the website. I encourage you to take a look at it. With that being said, would you like to do the honors?
Absolutely. Motion to adjourn.
Thanks, Sheriff.
Second.
Thank you. Second.
Lovely.